you unmute me? Sorry. Sorry, we just see a call-in user 416-338. Can you identify yourself on the call?
It's Nicole Welch.
Okay. Staff? Okay. Thank you.
Well, hello, everyone. It's Joe Cressy here. Nice to see all of you virtually, of course. I'd like to start today by confirming quorum so that we can begin this first virtual meeting of our board. So as we start off, I'll ask the board secretary to call the roll, please.
Directors, when I say your name, please unmute your mic, pause, and confirm your attendance by stating present and put your mic back on mute. Director Ashna Bowery. Director Ashna Bowery. Director Stephanie Donaldson.
Present.
Director Angela Johnson. Director Angela Johnson. Director Cynthia Lai.
Present.
Director Mike Layton.
Present.
Director Kristen Wong-Tam.
Present.
Director Joe Cressy.
Present.
Director Ida Lepretti.
Present.
Director Jennifer McKelvey.
Present.
Director Kate Mulligan.
Present.
Director Gord Perks.
Present.
Director Peter Wong.
Present.
Director Sue Wong. Director Sue Wong. Mr. Chair, we have quorum.
Well, thank you very much and welcome. I will officially now call meeting 16 of the Board of Health to order. Perhaps before I begin, I know that members of the public and certainly members of the board will join me in extending our deepest thanks and appreciation, certainly to the clerk's staff here at the city for pulling this meeting together, but in particular, Dr. Eileen Davila, our medical officer of health, all of our associate medical officers of health, and the entire TPH team. They have been exemplary, principled, relentless, and at all times compassionate. And so wherever you are, whether you're watching on YouTube, whether you're participating in this meeting virtually as a board member, clap your hands, bang on your desks, wave your hands. You should be deeply proud of our Toronto Public Health team and the whole family. So, Dr. Davila, thank you. I'd like to welcome members of the board to this special meeting, as well as members of the public following. This meeting is being held using the city's WebEx technology, with directors and staff calling in or connecting by video conference or attending in person at Toronto City Hall. Because we are meeting remotely, we ask for your patience with any delays and technical issues. Members of the public are observing this meeting on YouTube. This is also the first meeting we've had since the declaration of an emergency at City Hall where we have deputations. I know the clerk's staff here have gone to great efforts to ensure at our request that people are able, members of the public, to depute. As this is the first time, there may be some hiccups, but we will do our very best. And I know that as per the clerk's instructions, deputations were registered in advance. Those who have registered are actually already connected by phone, and they are registered to speak on the second item. Although we are in different locations today and meeting remotely, the Board of Health acknowledges the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Let me begin, directors, by asking if there are any declarations of interest under the Municipal Conflict of Interest Act. If you have an interest, please unmute your mic to state it now. Okay, hearing none, we'll proceed. Directors, as this is a special meeting under the Board of Health's Procedures Bylaw, the Board is considering the business on the agenda, not new additional business. We do have 3 items on the agenda. I know the bulk of it will be taken up with the second item, though we do have 2 other matters of routine course that we need to address. We do have 6 deputants registered on the second item. I know, having spoken with all of you in advance, that many of our board members, many of you are busy. We have people overseeing clinics, we have people in urgent conference calls, and so while we have structured this to ensure at all times we have quorum, I know that many members of the board will be popping on and off to deal with other emergency matters while we're meeting, and so we will do our very best. Let me commence by going through the order paper, and we'll begin the first item, HL 16.1, amendments to the board procedures to enable remote electronic participation in Board of Health meetings during an emergency. We have no deputations on this item. Would anybody like to hold this item down? If so, if you could unmute your mic. I'll ask again, because I know technology can be slow. Would anybody like to hold this item down? Okay, hearing none, I will move that we adopt the staff recommendation, and I'll ask, and I apologize, I know this can be slow, but it's important for transparency. I'll ask the board secretary to call for the vote. And so I have moved the staff recommendation.
Directors, when I call your name, please unmute your mic, indicate your vote by stating in favor or opposed, and put your mic back on mute. Director Ashna Bowery.
In favor.
Director Stephanie Donaldson.
In favor.
Director Angela Johnson. Director Angela Johnson. Director Cynthia Lai.
In favor.
Director Mike Layton.
In favor.
Director Kristen Wong-Tam.
In favor.
Director Joe Cressy.
In favor.
Director Ida Lepretti.
In favor.
Director Jennifer McKelvey.
In favor.
Director Kate Mulligan.
In favor.
Director Gord Perks.
In favor.
Director Peter Wong.
In favor.
Director Sue Wong. Director Sue Wong. Mr. Chair, that carries with 11 people in favor and 2 absent.
Thank you very much. Our second item on the agenda is item HL 16.2, COVID-19 update. We have presentations and speakers on that item, so that will be held down. And our third item is HL 16.3, proposed change to the Toronto Urban Health Fund review and allocation process due to COVID-19. We have no speakers on that item. Would anybody like to hold that item down? If so, I'd ask if you could unmute your mic and indicate so. Okay, I'll just ask again, just in case. Would anybody like to hold that item down? If so, if you could unmute your mic and indicate it. All right. So once again, I will move the staff recommendations here, and I would ask our board secretary to call the vote. Thank you.
Directors, when I call your name, please unmute your mic, indicate your vote by stating in favor or opposed, and put your mic back on mute. Director Ashna Bowery.
In favor.
Director Stephanie Donaldson.
In favor.
Director Angela Johnson. Director Angela Johnson. Director Cynthia Lai.
In favor.
Director Mike Layton.
In favor.
Director Kristen Wong-Tam.
In favor.
Director Joe Cressy.
In favor.
Director Ida Lepretti.
In favor.
Director Jennifer McKelvey.
In favor.
Director Kate Mulligan.
In favor.
Director Gord Perks.
In favor.
Director Peter Wong.
In favor.
Director Sue Wong. Director Sue Wong. Mr. Chair, that carries with 11 in favor and 2 absent.
Thank you very much. So that means we'll proceed to our next item. I see that our board member, Director Johnson, has joined us. Welcome. Can I just say off the top, as we've just experienced, that under this new virtual scenario, democracy may be slower, but it's no less important. So thank you all for joining, and thanks again to the clerks who are helping facilitate this. So we're now moving on to item HL 16.2, COVID-19 update. We have on this item 6 registered deputants, but as we would always normally do, we're going to begin with the staff presentations. We have a presentation from Dr. Davila. We have a presentation from our Deputy City Manager, Juliana Carbone, and a presentation from the General Manager of Shelter Support and Housing Administration, Maryanne Bedard. So we'll begin with those presentations, followed by the deputations, and then we will move into committee. And so I should also note that it would be at my request, we have that members of the board have worked tremendously hard on over the last 3 days, a package motion that will be moved on this item. I ask if that could be advance circulated so that the public has an opportunity to see that well in advance as well. So if I could ask clerks to do that. And at that point, then I'm going to turn it over to a face you've all come to see all the time on television, who is wearing a scarf, as always, the People's Doctor, Dr. Davila, for her presentation.
Thank you, Mr. Chair, and good morning, everybody. It is nice to see you on the screen. And we are now just calling up the slides for the presentation. Update to the Board of Health. We'll move to the next slide. So on the next slide, this will just give you an outline of what will be discussed in this brief presentation, and I will try to take us through as expeditiously as possible. We'll look first at the response of Toronto Public Health, again at a very high level, measures taken by the other levels of government in concert with what we were doing here locally, through an overview of COVID-19 data to date, and then thinking more on a forward-looking basis. What does the future look like, and what does the recovery phase in respect of COVID-19 look like? Next slide. So taking us back, it seems like a very long time ago, but it was only just a few months ago, back in January, that there was a new coronavirus that emerged on the scene in China, and we now know that the disease caused by this new virus is COVID-19. We had our first case locally here in Toronto towards the end of January, and then shortly thereafter, over the course of the preceding weeks and days, it became more of a significant issue, not just here, but certainly provincially, nationally, and internationally. And as you can see, that as Toronto Public Health, we certainly have roles in respect of this response. We've been very front and center, and those elements of the response include monitoring, preventing, and controlling the spread of COVID-19 as an infectious disease. Turning to the next slide, this is a very broad brush overview of the kinds of public health measures that have been implemented by Toronto Public Health. You'll have heard me speak to this several times. Case and contact tracing as the foundation of infectious disease follow-up, and our prevention and control measures as local public health. First ever class order under the Health Protection and Promotion Act to help support the important work that we do in infectious disease control. This helped to advance our efforts with respect to isolation and quarantine of those who were either diagnosed with COVID-19 or at high risk. Certainly, we had an important role in managing outbreaks in a variety of different settings. And as part of our response, we also worked with many, many partners throughout the city on a strong education and compliance campaign. And certainly one of the other aspects of our response had to do with ensuring that information was available publicly around COVID-19, this being a new virus and therefore the source of a great deal of anxiety and concern, as you can well imagine. Turning to the next slide, this gives you a little bit of a sense as to the response metrics that we've had to date. These numbers, of course, are constantly changing, and the work that we're doing constantly evolves to meet the needs. However, the principles underlying those measures and the actions that we've taken have remained unchanged. What we are seeking to do is provide the greatest protections for those who need it the most, and certainly to ensure that we are doing the best we can to save lives and to ensure that critical healthcare resources are available for all of us, whether we're talking about healthcare that's needed for COVID-19 or for the many other medical conditions that arise over the course of our lives. Turning to the next slide, this is just a slide to give you a sense of the kinds of activities that were taking place over the past several weeks. I'm not going to go through all of it, but suffice it to say that the collaboration and coordination amongst all three levels of government in response to COVID-19 in this period of time, I don't know of any other time when this level of collaboration has been seen and this level of coordinated response. All I can say is that it was truly remarkable. That's not to say that it didn't have its bumps and challenges along the way, but it is, I do think, something worth noting, and certainly something that we need to thank our other partners in government for their collaborative and coordinated approach to this particular situation. Turning to the next slide, this, again, will be a slide that constantly changes. The data on this slide are accurate as of May the 5th. Gives you a sense as to the case count that we've seen in the city thus far, almost 7,000 by that point, the recovered cases, and what's actually happening here in the city. I think the important point to bring out here in respect of this slide, and as I've mentioned through public briefings, is that we do have a circumstance where there are in fact two different outbreaks that are happening in our community. There is one that reflects the situation in the broader community, the broader community and City of Toronto writ large, and a different story that's being told and that is unfolding within the context of congregate settings, most notably long-term care homes. So just a couple of points to bring to your attention. You'll notice that when on the sort of pink, purpley section at the bottom right of the slide, that describes the circumstance in our congregate settings, most notably the long-term care homes. There are certainly other settings reflected in those data, but the most of those data reflect what's happening in long-term care homes. You'll note that the median age at death in those circumstances is higher, 11 years, in fact, higher relative to what we're seeing in the community. And you'll note that there's a greater proportion of females in those settings that are accounted for in those numbers. One, because we know that women tend to live a little bit longer and therefore are overrepresented in the long-term care community or the long-term care setting. And as well, because those figures include residents and staff, we also know that females are heavily represented in the staffing in those congregate settings. Hence, that offers a little explanation as to some of the differential you see between what's happening in the community and what's happening in congregate settings. Turning to the next slide, knowing what we know here at the Board of Health, the important role that we play in public health in terms of improving health status, but in particular, seeking to reduce disparities in health status, it is important to highlight that part of our data story involves understanding and establishing a better understanding as to the differential impact of COVID-19, whether there are in fact specific communities that are great or have more significant impact from COVID-19. We know that other jurisdictions are saying that they are noting specific and differential impacts in different sub-communities, whether we're talking about those of lower socioeconomic status or particular ethno-racial groups that are more severely impacted by COVID-19. As has been indicated through a number of public briefings, both at the provincial level and certainly here locally, the provincial data system and the data which we are required to collect under their purview at provincial public health does not currently include socio-demographic data collection and ethno-racial data collection in particular at the individual level. So thus far, Toronto Public Health has completed preliminary analyses looking at, as you can see here on this slide, our case and hospitalization data by small geographic area where cases live. And this is, again, a very preliminary analysis. Very challenging to take data that is collected at a group or geographic area and try to then bring it down to the individual level. There are clear challenges from a data perspective in so doing. However, what we have been able to identify through those preliminary analyses is that thus far we have the suggestion that COVID-19 cases and hospitalizations were more commonly reported for those living in areas in our city that have a higher proportion of low-income earners and recent immigrants. Again, very preliminary analysis, but what we are seeking to do now is to update our information system, again, an information system that was introduced in the midst of this, our response to this pandemic. We are going to be asking, though, once we're able to effect these changes to our information system, COVID-19 positive individuals about race, income, household size, Indigenous identity, and First Nation status, so that we can get a more fulsome analysis of this issue in our community. I do also want to highlight, although it's not specific to socio-demographic data, this is one area of activity that we have undertaken at Toronto Public Health as part of our response that wasn't reflected in the initial slides around the many public health measures that have been put into place and that have been implemented in response to COVID-19. I would be remiss if I didn't talk about some other activities that have been undertaken and are continuing to proceed. We have been doing work in partnership with many in our community and other city divisions, whether we're talking about work in concert with our Shelter Support and Housing Administration colleagues on testing and helping to support infection prevention and control in shelter and respite settings. We've done some work, certainly, with our colleagues in transportation services. As I've mentioned, we introduced a new information system to better support our ability to provide timely COVID-19 response. And we've certainly done a fair amount of work in respect of the continuing overdose crisis that continues in our city over and above COVID-19. And we know that COVID-19 itself has had some very serious impact on those who use drugs in our community and their health and safety. So that work has proceeded throughout the response and continues on, in fact. So if we can go to the next slide. This slide depicts information as to the end of April, as you can see at the top of the slide, and it depicts the reproduction number. And basically what we're trying to show here is that, early in March or in early to mid-March, for every case of COVID-19 that we had in our city, that particular case gave rise to almost another 4 cases. That's what the reproductive number refers to. As we were approaching the end of April, we were getting that number down to 1, which means that for each case of COVID-19, on average, one more case of COVID-19 was being created as a result or transmitted. The concept here is that you get better, what we're seeking is to bring that number below 1. Because what that means is when the number is below 1, transmission will ultimately arrest in the community, and you will have what we can call disease control. Unfortunately, we had been hovering around 1 for the last several weeks. Just getting in some information early this morning suggesting that, in fact, we may be starting to drift up a little bit. So this is the kind of thing that we must constantly be vigilant for. Constantly watching and observing what is happening in our community. So we can go to the next slide. This basically captures what I've just told you verbally, speaking about what the circumstances were in mid-March, how physical distancing and the implementation of public health measures writ large was successful in terms of bringing down the reproductive number and reducing the transmission of COVID-19 in our community, and where we are seeking to get, which is bringing that reproductive number below 1. However, we are just getting some data, as I mentioned, that suggests that we may not be hovering at 1 right now. We may be seeing some increase. I think it's important to note that we are going to continue, of course, observing that and making sure that we are adjusting our public health actions in accordance with what we're seeing in the community. Going to the next slide. We do need to start looking towards the future. This is what we're terming moving from COVID response to COVID recovery and rebuild in the city writ large. So what do we need to see? As mentioned earlier, we need to see evidence of good disease control in the community, including reduced transmission as well in congregate settings. We also want to be sure that there is sufficient healthcare system capacity. It's important to know that we've seen circumstances in other jurisdictions, and we've seen the devastation that has been wreaked upon health systems throughout the world and healthcare institutions throughout the world. When you have a significant amount of COVID-19 activity that requires hospitalization and hospital-level care, and the hospitals are also trying to attend to other medical conditions that arise, this has been overwhelming for other healthcare systems throughout the world, and we are absolutely working with our acute care partners and others to ensure that we don't find ourselves in that circumstance. As well, the final point on the slide has to do with public health capacity. We need to, as we seek to ease public health measures, relax public health measures, we need to assure ourselves that from a public health perspective, we are able to provide not only effective, but extremely timely case and contact tracing. And the indicator that has been set, or the criterion that has been set by our provincial counterparts, is seeking to ensure that we do all contact tracing within 1 day. Going to the next slide. Just to further elaborate on the principles that we will be seeking to observe as we move from COVID response to recovery, it will require a gradual easing of public health measures. We have seen from other jurisdictions that, throwing the doors open and reverting back to the time pre-public health measures doesn't make sense. In fact, it may create all kinds of challenges, both for public health, for healthcare, and frankly, for the benefit of our community. We'll want to observe that things are that easing public health measures is not creating undue burden, both in terms of illness in the community and on healthcare. It is important to note, as we move forward with COVID recovery, that there will be some public health measures that will continue for the foreseeable future, and that will become part of how we live for the time being with COVID-19 in our community until such time as we actually get effective treatments for COVID-19 or a vaccine. We want to find ourselves in a circumstance where we are avoiding the reversal of any changes in public health measures wherever possible. And of course, the fundamental principle here is finding the wisest balance between COVID-19 protective measures and the ability to ease up on public health restrictions and measures for the broader community. Last slide, just to conclude my remarks. Clearly, this has been an unprecedented global health emergency. It has required, what's described here on the slide as a fulsome public health response. It has pulled on every fiber of Toronto Public Health, and I would say that that's not unique to us. I think every public health agency around the world has felt that very same pull. We will be moving as we see positive signs in respect of our surveillance from a more COVID response mode to one that balances response with recovery. As always, our decisions will be based on the best available evidence, which includes experience from other jurisdictions. And what this will mean for us as Toronto Public Health as an organization is that there will be elements of the organization that will be focused on COVID response, ongoing COVID response activities, COVID recovery activities, and then, of course, there are also all the other essential public health activities that we have been doing for many, many years now that are not related to COVID-19, but are significant to the health status of our community. So those activities will have to resume. If I can, while I have the benefit of the microphone, I would like to take just a few moments, and I promise to be brief, Mr. Chair. First and foremost, I think there are a series of thanks that that Toronto Public Health owes to many of you. To you, Mr. Chair, for your undying support and constant support to all of us throughout this unprecedented and very challenging time. To you, the members of the Board of Health, you have offered much support and communicated our messages, I know, through your constituencies and through your networks. For that, we thank you. To City Council and to the Mayor for all that you have done in terms of supporting the public health objectives. To our colleagues all around the city who have been fabulous partners and collaborators. I'm looking at one across from me. She is just one of many, an important one, but one of many. I'm also looking at one to my left. The collaboration and support has been truly amazing and very, very much appreciated. I don't know that we can thank you enough. External partners, whether in the public sector, private sector, community agencies, all been incredibly supportive through this very, very difficult time. And I will tell you, it has been a very challenging time. But lastly, and certainly not least, the Toronto Public Health team. They have been absolutely incredible. And I get sort of emotional about this, so I'm sorry. I was looking up definitions of what it is that constitutes heroism. And what I found was that it talks about actions done in service of others in need. And it talks about integrity and courage and self-sacrifice and selflessness and determination. And I'm really sorry for getting emotional about this, but to my team at Toronto Public Health, thank you. I'll leave it at that. I'm going to wrap it up. You are heroes in every sense of the word. And for that, you have my undying gratitude. I'm sorry, Mr. Chair. I think I better stop. Sorry, everybody.
Absolutely no apologies necessary or accepted. Dr. Davila, our compassionate rock at all times. Thank you. We now have two brief presentations. Thank you for that fulsome presentation. We have a 5-minute presentation from our Deputy City Manager, Juliana Carboni, on the range of community and social service supports, followed by a 5-minute presentation from Maryanne Bedard. And so, Juliana, let me turn it over to you for 5 minutes, please.
Morning, everyone. And Eileen, thank you for your leadership. You are leading this city, the Toronto Public Service, and what you're doing is absolutely heroic. So to you and your team, thank you. So I just want to quickly highlight some of the important work that the program areas under community and social services are doing throughout this emergency. Since the onset of COVID, our teams have been focused on strategizing and coordinating supports for our more vulnerable population. We rapidly connected with our strong network of community partners, really to assess and understand how the pandemic was impacting families, communities, individuals, neighborhoods. And then we used that knowledge, as well as our collective resources and expertise, to quickly mobilize a host of services to support and protect vulnerable Torontonians. So the community not-for-profit sector, as you can all appreciate, has always been a vital partner in serving our residents, and that work is even more important now during this emergency. So early on, we at the city established a city community response table with representatives from over 74 agencies and 11 divisions. It was meeting initially daily for the first 6 weeks or so. We're now meeting 3 times a week. And it's really to identify and discuss issues that are affecting vulnerable residents and Torontonians and to strategize on how best to support them and meet those needs. So working together, what you see on this slide is 8 priority areas of focus that were identified. There's areas of high need where we need strategies in order to better support our communities. We have teams assigned to each of these priority areas, and those teams are working on formulating and launching a whole range of actions and initiatives to help stabilize the lives of residents. And it's important to note that within each of these areas of need, services are provided not only by the city, but also by our community partners and other governments. So we are really working together. The areas that are highlighted in green are areas where we have strategies and initiatives already launched, and the other areas we're actively working on launching soon. Going to the next slide. The next few slides are just going to highlight some key areas where our programs had to step up and rapidly scale up and transform in order to effectively respond to what you can imagine was ever-changing and evolving needs within our community. So long-term care was very proactive early on introducing infection prevention and control measures well before the province required such measures across all homes. And out of the abundance of caution, all of the city's 10 city-operated long-term care homes are operating under strict outbreak protocols. There was an independent audit by an independent health team across our homes, confirming that the practices that we're using in our 10 long-term care homes are in fact leading practice. And to date, all of our residents, over 2,600 residents, have been tested, and over 70% of our staff have been tested. The balance of the staff testing will be completed next week. I'm not going to speak to the shelter enhancement because Maryanne has a separate presentation summarizing as Eileen put it, the heroic work that she and her teams have been doing and continue to do in terms of supporting our shelter clients through this COVID emergency and helping to get people housed. But I do want to highlight one thing, and that is at Council's meeting, they approved accelerating our modular housing initiative. So we are planning on having 110 modular units completed and occupied by the end of September, followed by an additional 140 in 2001. So moving on to the next slide. So Toronto was the first municipality in Ontario to actually open up the emergency childcare centres that were mandated by the province or required by the province. We started with 4. We're now up to 7, but unfortunately, only 6 are operating at the moment. You know, despite our best efforts and working hand in hand with public health to ensure that we had the strictest, most rigorous infection control and prevention measures in place across all of our emergency childcare centres, we have 2 centres where COVID is now present. So Jesse Ketchum was closed on April 29th, and public health is working with us to help investigate, and we do hope that those investigations by public health will help us understand the cause and help us learn how we might be able to enhance our already rigorous practices and how we can effectively mitigate the risk associated with operating in a world where COVID exists. So as the province restarts businesses across our city and across the province, childcare is most likely going to be a pretty vital component. So we have to get this right in order to, we're not going to be able to totally eliminate risks, I appreciate that, but mitigate them to the fullest extent possible. Access to food, I have to tell you, is by far the most pressing issue that we're hearing. And the city partnered early on with Red Cross on a food hamper program for seniors and other vulnerable residents that have to isolate and can't get out to get their food. The library, our Toronto Public Library, really stepped up. We have 12 library sites now operating as food banks, and those banks are staffed by library staff. We worked with public health and we repurposed student nutrition grants to grocery cards for student families. So students that would have been attended our nutrition programs now get a $50 grocery card. Over 3,000 prepared meals have been delivered to those in need, so those that aren't able to prepare their own food. And we are working with our community partners and hope to scale up to 14,000 meals per week. So Second Harvest, United Way, the various colleges, and as well as some Indigenous chefs. Community gardens, I think you all heard, province allowed to open up, so our community gardens here at the city opened this week, and the allotment plots will open soon, we hope. Mental health, we're seeing a very increased need, and we did partner with 211 as well as 8 mental health providers, and residents can now call and be connected by phone with a warm transfer on getting the supports we need. And I can tell you that on the senior side, we are seeing a dramatic increase. Even Red Cross, as people were calling to register for food hampers, the staff that were taking those calls could tell that the seniors were in distress. So the Red Cross is now also supporting that cause, and when they deliver the food hamper, they also offer mental health supports for those seniors. On to the next slide. So social assistance, as you can imagine, continues to be very much a need. We had 5,000 new cases since COVID started, and we're continuing to process our OW application so that we can support people. The province did introduce a one-time benefit for COVID-related expenses. It was originally only for 2 months, March and April. They now have extended it to July, and to date, we've had 30,000 applications that we've been processing. Paramedic services implemented early on a number of measures to protect both staff and patients. They learned a lot through SARS, so we were a lot more quickly out the gate to make sure we had proper measures in place, and they are seeing a lower level of calls. Originally, the number of calls for 911 for paramedic services was down 10% early on when COVID first hit. Now we're down 5% compared to last year. Many telecom companies have stepped up and offered to help, and so now we have free Wi-Fi thanks to those partnerships and donations in some of our low-income neighborhoods. So 25 large apartment buildings in low-income neighborhoods are being connected free of charge for those residents. We have all of our long-term care homes are now connected to Wi-Fi, and that's on a permanent basis, and 4 of our shelters. We've also had donations for free food and tablets for shelters, for social agencies, and for vulnerable residents. And this week, I'm very excited that we're launching virtual recreation and learning programs on the city's website. And this is just really a sampling of everything that we're providing, and I can commit to you that we will continue to work with United Way and our other community partners to continually monitor the impacts and respond appropriately. So in terms of the last slide, in terms of next steps, as I mentioned, we're working to scale up the food program. That's the most pressing issue that we're seeing. We're also focused on ensuring that we're leveraging the dollars and the resources that we're putting forward to respond to COVID in a way that can help accelerate our council's 10-year housing plan. So the council had adopted last year a plan to build over 10 years 40,000 affordable housing units, 18,000 of which would be supportive. And as we secure sites to create the physical distancing that we need within shelters, we are continually focusing on trying to acquire some of those sites on a more permanent basis so that after we get through this emergency, we can convert those to supportive housing. We're planning in case, as Eileen tells me, there might be a second wave. So I was a Girl Guide. We have to be prepared, and we're trying to put those plans in place. We're also planning on how best to restart city services and how to support our community not-for-profit agencies through a restart and recovery phase. Needless to say, I think we can all appreciate that when we come out of this, we're going to have to operate and provide services in the future very differently than we did pre-COVID. And we're hoping to learn through this experience, through this emergency, and use those learnings to continually improve and grow more resilient. And needless to say, our vulnerable communities are a very important part of our city, and we will continue to partner with our community agencies to ensure that they are appropriately supportive. Thank you.
Thank you very much, Juliana. And our final presentation, Maryanne Bedard, the General Manager of Shelter Support and Housing Administration. Maryanne, over to you.
Thank you, Mr. Chair. I'd like to start my presentation also with thanking Dr. Davila and her entire team. As you can imagine, Shelter Support and Housing has needed to be in lockstep with TPH as we have rolled out our plan, and it's been an incredible partnership, and we've really benefited from your support, so thank you. So since the onset of COVID-19, SSHA, with support from hundreds of redeployed staff from across the city, as well as critical community partnership, we've worked around the clock to act swiftly and significantly to the challenges in front of us. And we have continued to adjust and respond as the pandemic has moved through the city. To give you a sense of the current context, Toronto has the largest shelter system in Canada. It's larger by far. We shelter 7,000 people on average every night, including almost 3,000 people who were already sheltered in hotel settings. 11 of those locations are operated by the city, and 61 of those locations are operated by our community nonprofit agencies. We knew at the onset that people experiencing homelessness were going to be particularly vulnerable to illnesses like COVID-19 because of the underlying health and socioeconomic conditions. Our objective at the beginning was to keep COVID-19 out of the shelter system for as long as possible to allow us some critical time for planning. Given the scale of this pandemic, unfortunately, we knew that despite our best efforts, it would only be a matter of time before it did enter our shelter system. And as of May 5th, there are 261 confirmed cases of COVID-19 in our shelters and 7 active outbreak sites. So we developed early on a 3-tiered response that focused on prevention, mitigation, and recovery. The response was based on a strategic risk analysis that we did early on and a phased approach so we could prioritize actions with the primary goal of saving lives and ensuring that the healthcare system did not become overwhelmed. Our response has been intergovernmental, intersectoral, and has involved other city divisions, the provincial and federal government, provincial healthcare sector, and the community nonprofit sector. We have rapidly implemented this plan, mobilizing our response on an urgent basis to be as prepared as we can and to stay that one critical step ahead of a very rapidly evolving situation. To delve a little deeper into each tier, our first aim was prevention. So the initial objective of prevention, keeping COVID-19 out of the shelter system for as long as possible. We provided over $6 million to our community agencies, 24-hour respites and drop-in centers, so that they could increase their infection prevention and control measures, they could secure their own personal protective equipment, and they could recognize the important work of their staff by increasing their wages. We rapidly opened 23 new facilities, and we have to date moved 1,800, almost 1,900 as of this morning actually, people out of the shelter system. And this has allowed us to create physical distancing within our shelters and physical distancing within the new locations. We have secured hotel rooms, we've opened temporary sites in community space, we've opened housing programs for people in encampments, and we continue in those efforts so that we can continue to follow public health guidelines and create that all-important physical distancing. Our second tier was mitigation. And we wanted to mitigate the impact of the pandemic and protect those in our shelter system. And so we put measures in place for active screening, testing, providing isolation, all to slow the transmission of the virus in the shelter system. So we implemented standard screening processes using public health guidelines at all points of entry, whether it's by phone or in person. We actively screen and monitor clients and staff at all our sites using a screening tool that we developed. Transportation has been provided for clients to assessment centres for testing. And we have also continued to advocate vigorously to the province for prioritized testing in our shelter and respite sites. We also created a dedicated isolation program with appropriate health supports for those people who are waiting test results, and this was a first in Canada. Given the significant improvement in the turnaround time for test results, this program has now been able to transition to provide space for people who were in close contact of confirmed cases so that they could isolate for a required period of 14 days to see whether or not they had contracted the virus. We have moved more than 150 people into that isolation space to date. We have transported more than 200 people to assessment centres for testing. And in the first week of our response, we also established an isolation site at a hotel for people who had traveled. Very early on in this pandemic, a lot of the illness was associated with people who had traveled, and we realized that that was critical for us to keep the virus out of the shelter system. And we continue to work with the federal government on their border policy going forward in the future. The third and final phase is the all-important recovery phase. We opened a site for recovery for people experiencing homelessness who tested positive for COVID-19. These are people who are not ill enough to be in hospital, but are contagious with the virus and not able to return to the shelter system. So it was critically important that they have a place where they could recover with dignity, and we are preparing now to open a second site. We also know that regardless of this pandemic, the best and only solution to homelessness is to provide people with permanent housing. So in addition to measures to rapidly rehouse clients during this current crisis, we are moving quickly to take advantage of all the opportunities to advance longer-term housing solutions. To date, we have been successful in moving 218 people into permanent housing through our rapid rehousing initiative, housing allowance, and rent geared to income in our social housing. We are also leveraging investments for permanent housing and looking to secure properties for long-term housing opportunities, as Deputy Carboni referenced. We also recognize in a time of economic uncertainty, we did not want to have an increase in the number of people who became homeless. And to that end, we've increased our rent bank program by $2 million to ensure stability of low-income renters to stay in their homes during this difficult time. And I'd like to thank City Council, who on April 30th approved our Canada-Ontario housing benefit, which will provide 1,300 low-income households from the centralized waitlist with a portable housing benefit to help with their rental affordability. And this benefit will be rolling out this month. Our response has been built on a foundation of strong communication and critical partnerships. We have worked closely with our sector networks to implement this response. The Toronto Shelter Network, the Toronto Drop-In Network, and the Toronto Alliance to End Homelessness have been critical partners. We've been hosting regular webinars in partnership with public health with our community agencies, sharing information, answering questions, receiving feedback on our strategy. We've had critical partnerships with the healthcare sector, including the Inner City Health Associates, the Inner City Family Health Team, University Health Network, and the Toronto Centre Local Health Integration Network. We've been participating in the Community Response Table, which meets daily and includes representation from more than 30 community agencies across Toronto and 11 city divisions. And we've been working with United Way to coordinate supports across organizations and neighborhoods and agencies. So in addition to our pandemic response, we have also been moving forward critical housing and shelter work that we do on a normal basis to ensure the ongoing stability of our system. And I would like to recognize the incredible work of our shelter support and housing staff. I consistently hear from people who have been redeployed to the shelter system how impressed and inspired they are by the dedication of the staff in shelter support and housing. They are doing a critical role in the programs that we run, and that role is being mirrored in our community agencies with our frontline shelter staff. So I'd like to thank every single person out there fulfilling this function. Thank you.
Well, thank you. Thank you for the comprehensive presentations. At this point, before we move it into committee for questions, we have deputations. And I'm delighted at our request, and the team at Clerks has made this possible. This is a first for the city since we've gone virtual, so we're going to do our best. Thank you. So we have 6 deputants. We're going to hear them one by one. To members of the board, they are joining by telephone. And so they will be unmuted. They will have 5 minutes. And then what I'll do at the conclusion of their 5 minutes is I will ask members of the board to unmute yourselves if you have a question and indicate your name and say question, and I will put you on the list. So to our speakers, our first speaker is Sarah Garnett from the Toronto Drug Strategy Implementation Panel and the Toronto Harm Reduction Alliance. Sarah, thank you for holding tight with us. And to Clerks, you can unmute Sarah when you're ready. Sarah, you'll have 5 minutes. I will keep time for you, but I'll give you a heads up when you sort of have 30 seconds left, if that's all right. So Sarah, you can start when you're ready. We can hear you.
Okay, you can hear me okay? I just want to check.
I got you.
Okay, perfect. All right, thank you. Okay, so first I want to say thank you to the chair and to the board. And before I get going, I just want to say I'm going to be speaking to Councillor Gore-Pert's letter regarding safe supply. So I'll start by saying my name is Sarah Garnett. My pronouns are they, them. I sit on the Drug Strategy Implementation Panel, and I'm a steering committee member of the Toronto Harm Reduction Alliance. And I'm a harm reduction worker who is currently on leave due to the emotional distress, including the unwavering guilt that has come with my job. Like I said, I'm speaking today in support of Gore-Pert's letter and the Toronto Drug Strategy's motion in regards to safe supply programs, especially in the time of COVID. It is an especially grim time for those working on the front line for many reasons. Today, I'm here to speak about overdose, an issue we've been fighting against for over 5 years since the crisis ramped up. In 2019, in Toronto, approximately 300 people died of an opiate overdose, 1,200 in Ontario. A recent report noted that 25 Torontonians overdosed and died last month, the highest recorded number since September 2017. That's almost one person a day in our city. Monthly numbers will only rise unless immediate action is taken. Initial reports from May well demonstrate that trend. Simply put, our drugs are toxic. They're killing our community, coworkers, and loved ones. These deaths were preventable, and the neglect to take serious action is shameful. There must be no more half measures. Naloxone and Safe Site are not overdose prevention strategies, they're overdose response strategies, and we need true preventative care. The overdose crisis is unlike most public health emergencies because we know what needs to be done. The solution to end this is right at our hands, and it is a regulated, safe supply of substances. Headway has already been made. There are smaller safe supply programs set up. We need an expansion of these services and incentives for NPs and physicians to prescribe safe supply and for these life-saving drugs to be covered so those who are most marginalized can access them. We need these to give people who use drugs options that work and meet them where they're at. Methadone and Suboxone are not realistic options for everyone. Deterrents like drug tolerance or withdrawal required for Suboxone create barriers, leading people to medicate through the illicit market. Furthermore, fentanyl has taken over the drug market and is contaminated with a myriad of substances that are causing unpredictable reactions. The Toronto Drug Checking Project confirms this, what we already knew. Now, more than ever, due to the state of the current illicit drug market, we need injectable hydromorphone, acetylmorphone, and dilaudid pills. This is one way to decrease the stronghold that fentanyl has on the illicit market. Prescribers that have a safe supply program such as this have proven to stabilize people who use drugs so they are able to focus on other aspects of their well-being, such as physical, social, and financial health. These programs are an avenue for people who don't normally access healthcare to build relationships with healthcare providers to address other health needs. Not only do they save lives, and they initiate preventative care. And I think especially now, these things are important. That being said, as we sit at the intersection compounding crises, overdose, housing, and now a pandemic, people face a heightened risk of fatal overdose. In addition to the risks noted in Councillor Prick's letter, I'd like to highlight a few situations in particular. People are being asked to stay home, to physically distance in order to flatten the curve and protect society at large. However, a standard overdose precaution is to not use alone. Can you see how these two health directions are contrary? Although there are OPS and SIS in the city, there are gaps in service, regardless of the presence of COVID or not.
Sarah, just a heads up, you have about 30 seconds left. Thank you.
Oh my gosh, okay. People who use drugs rely on community care and ensure they are safe. In this light, people who use drugs are the real first responders to the overdose crisis. Without safe supply, you're asking people to make an impossible choice between curbing the infection rate or putting themselves at risk of overdose without anyone being around to respond. You're asking them to risk death. Additionally, standard overdose response is respiratory intervention, such as rescue breath. Again, this puts people at an impossible situation. Do they risk contracting COVID so they can give the rescue breath to save the lives of their loved ones? I ask you to consider what you would do faced with that life or death situation.
Sarah, you're just over 5 minutes. I'm just going to ask you to wrap up in a sentence if you could.
Okay. So essentially, I'm asking you to take the same notion of urgency to do everything in your power to prevent people from having to make these impossible choices. Be champions in your realm to support a safe supply program and bring the powerful notions that will be held in this room, the Minister of Health, Christine Elliott. Safe supply is a lifeline. Naloxone may bring people back, but a safe supply can prevent them from overdosing in the first place.
Thank you, Sarah. And thank you to the clerks for our first deputant in the new normal era. Sarah, thank you so much. I'm now going to ask, are there any members of the board who have questions? If so, I'd ask you to unmute and just say your name and question. Okay. Hearing none. Sarah, thank you so much. Our next speaker is Dr. Gillian Kola from the Canadian Institute for Substance Use Research, University of Victoria. Gillian, are you on the line?
Yes, Councillor, I'm here.
Great. Joe is fine. Until I'm 40, no need for counselor. Gillian, you'll have 5 minutes. You can start when you're ready, and when you start, I'll start the clock.
Thanks so much, Joe. So my name is Gillian Kola. I'm a public health researcher here in Toronto, most recently at the University of Toronto, and I'm currently a postdoctoral research fellow at the Canadian Institute for Substance Use Research at the University of Victoria. I study low-threshold measures to improve the health of people who are experiencing marginalization. And over the last few years, my focus has been on measures that can be used to address the devastating overdose crisis in North America, and on the harm reduction measures that can be used to hopefully reverse the trend of deaths that we've been seeing. I would like to thank Councillor Perks for his letter to the Board of Health, urging the province to support the implementation of safer supply programs, in particular the listing of high-dose formulations of hydromorphone on the Ontario Drug Benefit. This is a measure that's urgently needed to help us increase the spectrum of options available to people who use drugs and address the overdose crisis. This is particularly important given the fact that we're now facing intersecting public health crises, with both the overdose crisis and the COVID pandemic coming together to devastating effect in our communities. And I just want to thank Sarah for highlighting some of the devastating ways that this is coming together in our communities right now. I just want to provide a little bit of background for why I'm supporting Councillor Perks' letter. In 2018, there were over 4,600 deaths due to opioid-related causes across Canada, with almost 1,500 of those overdose deaths in Ontario alone. And while we don't have full data from 2019 yet, based on data up until the end of September 2019, and we have no reason to believe that this trend didn't continue through to the end of the year, Ontario will actually surpass BC in 2019 as the province with the most overdose deaths in Canada. This should give us all pause, and I would like to acknowledge the thousands of friends, family members, and community members in Ontario that are grieving the loss of a loved one from overdose. Unfortunately, the rate of overdose deaths has not decreased over the first few months of 2020. And we learned from an alert circulated by the Toronto Drug Strategy Secretariat just 2 days ago that in April 2020, the Toronto Paramedic Service attended the highest number of opioid-related overdose calls in a month since September 2017. Now, the reason for this is that illicitly produced fentanyls are taking over the drug supply. We're now at a point where illicitly produced fentanyls are responsible for 82% of all opioid-related deaths in Canada, according to data from Health Canada. And the number of deaths has been increasing year over year as fentanyl has permeated the drug supply. We need to be doing more. Frontline harm reduction workers across the city have been making valiant attempts during these intersecting crises to support people who use drugs. In other jurisdictions in Canada, like in BC and Alberta, they've expanded their response to the overdose crisis by expanding the range of safer supply options available to people to address the contaminated drug supply. And in BC in particular, the rapid expansion of these programs has led to a decrease in the number of overdose deaths that they're seeing. Quite simply, in Ontario, we need to do the same. Safer supply programs are actually quite simple. They transition people from the contaminated street fentanyl supply onto a known dose of a pharmaceutical opioid under the supervision of a doctor experienced in this type of care. Vancouver has been offering high-dose hydromorphone as part of a spectrum of options available to people who use drugs since 2011, first as part of a research study, and following results that showed high levels of effectiveness as part of a range of options available in community settings. In Ontario, we've been completely unable to scale up injectable hydromorphone programs. This is because there's no coverage available for the medications necessary to run these programs on the Ontario Drug Benefit. We'll be unable to offer the full range of options for diverting people from the contaminated drug supply until there's coverage for these medications in our province. High-dose hydromorphone needs to be added to the formulary as requested in Councillor Perks' letter, but I would also like to note that it needs to be accompanied by full infrastructure and staffing support to run these programs from the province. We need a spectrum of options to address this crisis. I've been working with a different type of safer supply program in Toronto and London to begin research and evaluation of these programs. And while they're incredibly promising, they're still very, very small because they lack support from the provincial government. We desperately need a rapid expansion of broad and comprehensive support from all levels of government working together to address this crisis. And quite frankly, I've been frustrated by the slowness of the provincial response to the crisis here in Ontario. It feels like we've been stalled since 2018 in implementing the full range of evidence-based options to address the overdose pandemic.
Jillian, just a heads up, you have 30 seconds.
Yes. I'm just finishing up. I would just like to say that I appreciate the Board of Health's leadership in attempting to continue to push the response to this devastating crisis forward. And I strongly urge the Board of Health to support Councillor Perks' letter today and also to support the broad expansion of a spectrum of safer supply programs in Toronto to address the overdose crisis. Thank you very much.
Jillian, thank you so much, and thank you for taking the time. I know all speakers had to join us early this morning. At this point, let me ask members of the board, if you have questions, if you could unmute yourselves and say your name and if you have a question. Okay. Thank you very much, Jillian. Our next speaker if our team here at the clerk's office could get ready, is Jeanette Bowles from St. Michael's Hospital, the Center on Drug Policy Evaluation. Jeanette, welcome. Are you there?
Hi, I'm here.
We can hear you loud and clear. Whenever you're ready, I will start your clock.
Thank you so much. So thank you all for allowing me the time to speak today. My name is Dr. Jeanette Bowles, and I'm a postdoctoral fellow at St. Michael's Hospital and the Center on Drug Policy Evaluation. I really want to echo what Sarah and Jillian just said before me in hope to do justice to supporting their work. For the purposes of this meeting, I want to first draw attention to the concept of health and health policies, which is a statement that I hope guides decision-making as Toronto forges ahead in addressing COVID-19 and overdoses. COVID-19 has certainly changed the world as we knew it quite rapidly, and while most services have needed to adapt in order to reduce the transmission of this highly contagious pathogen, the means of preventing both overdoses and the acquisition of COVID-19 are surprisingly similar for people who use drugs, which I will get into after providing some context. Since moving here, I've had the privilege to work alongside some of Toronto's leading infectious disease physicians and epidemiologists and drug use activists and with people who use drugs, who seem to have a consensus on how to better the lives of those experiencing structural vulnerabilities, such as being precariously housed and combined with substance use. So I've spent years of my life advocating for people who use drugs and people who are precariously housed and whose health and very lives are at risk for various reasons. The overdose crisis kills thousands of people in North America each year, resulting in unending pain for families and other loved ones. And while incredible progress has been made in expanding overdose prevention in Canada, the rapidly increasing variability in street drugs has created an environment that simply demands a rapid increase in effective fatal preventative response as well. COVID-19 has sadly amplified this as the case fatality rate of fatal overdoses has increased over the last 3 months, which is sadly unsurprising to many of us who work in this field, as we know that isolation plus contaminated street drugs are a lethal combination. Drug use and homelessness are also characterized by social networks and social interactions that make physical and social distancing suggestions especially difficult. These social behaviors do not simply stop because of a pandemic. People who use drugs have been living under the duress of infectious disease. And while COVID-19 adds another layer, it does not simply end the need for drugs. That being said, treacherous times such as now do not result in drug use reductions. If anything, economic uncertainty, stress, and fear of the unknown lend to increases in drug use. This includes persons who might not frequently use drugs but have begun using or return to using on account of stress, which in addition to the toxic drug supply could exacerbate overdose events. And while the toxic drug supply includes fentanyl, it goes beyond that and includes unexpected benzodiazepines, which exacerbate overdose death, and also leads to other lethal conditions like endocarditis, osteomyelitis, cellulitis, and other infections that frequently harm and kill persons who use drugs or result in their being in the hospital for extended periods of time. These conditions are preventable, and keeping as many people out of the hospital right now as possible is incredibly important on account of COVID. However, these issues are further compounded by the fact that many people who have died of COVID are residents of communal living facilities. In spite of best efforts by employees to encourage physical distance measures, it is simply an unmanageable request when people do more than just sleep in these spaces. Spacing beds apart is not enough. These are spaces where people dwell, where they eat, where they live part of their lives. The bottom line is maximum capacity of these residences changed as quickly as the world did when COVID was determined to be of pandemic proportions. So, to address the confluence of these varying factors impacting people who are homeless and who use drugs, there are tangible things that can be done. To start, harm reduction programs deserve enhanced autonomous support as they know their communities best and are similarly on the front lines of providing essential services to the people of Toronto. They are the unsung heroes as they work not only with the most marginalized of communities, but the most stigmatized. Next, people need housing and temporary individual spaces until permanent housing has been established. Health simply does not exist in the absence of housing, so I was glad to hear the effort to expand housing, but we must not give up until homelessness is eliminated.
And Jeanette, just a
Finally,
heads up, you
people
have
who
about
use
30
drugs
seconds
need-
left.
I'm wrapping up. Finally, people who use drugs need a safer supply of drugs, considering the state of street drugs. My background in social work and public health have always pointed to the importance of the simple concept of options. Options like buprenorphine and methadone are not enough. Expanding options by encouraging and incentivizing prescribers to prescribe hydromorphone are a great start. But to echo what Jillian and Sarah said, adding higher dose concentrations of hydromorphone to the ODB injectable formulations are critical at this time, as it would result in safer self-isolation and less need to break self-isolation.
Jeanette, I'm just going to ask you to
use drugs
conclude
who
with
ideally can
with a
end up
sentence.
in private housing opportunities. Thank you for letting me speak.
Thank you so much for taking the time and sticking with us. To members of the board, if you have a question, if you could unmute and indicate so. Okay, hearing none. Thank you very much, Jeanette.
Joe, I'd like a question.
Oh, excuse me. Yes, Councillor Perks, you'll have 5 minutes.
Thank you so much for that. That was very helpful. I was wondering if you could talk a little bit more the kinds of congregate living settings that you were talking about. That's a piece I'm trying to wrestle with.
So I was predominantly talking about shelters. And so I know that the highest risk, or like the spaces that we've seen the highest like outbreaks of COVID so far have been the shelters for persons who are refugees. But that doesn't mean that like the shelters in Toronto for persons, for persons from Canada who are living in homeless shelters, they're essentially stepping into fire each time they step into one of the like existing homeless shelters in the city right now. While there might not be like a massive outbreak as we've seen in some of the other like congregate living facilities that have been for folks who are refugees, that there's very little reason not to believe that like I live in Moss Park personally, so like I live down the street from Fred Victor and from the Salvation Army, and that when I was mentioning kind of like spacing beds apart not being enough, it's that the way that this pathogen seems to be evolving is it's like rapid fire, right? And so if a few people were to be contaminated and then are living within these facilities, the same way that we have seen in other shelters for folks who are refugees here in Ontario, it could take off like wildfire the exact same way in any of the shelters. And so one of the notes that I had written down was that like the maximum capacity that was once considered for a homeless shelter changed the moment that a pandemic was struck. So while maximum capacity might have once been 200, we really need to redefine what maximum capacity means in these communal living facilities right now. So I hope that answers your questions. I mean, it's really just based around like how highly communicable this disease is.
Thank you. Councillor Perks, do you have any further questions? No. Okay, thank you. Any other members of the board with questions? If so, if you could unmute yourself and indicate so. Okay, hearing none. We're going to go to the next speaker. Just before we do, can I take a moment to comment on Councillor Layton's beard, which I think is growing in marvelously well. Our next speaker is Aaron Kaplan from the Toronto St. Paul's Tenant Associations Network. Aaron, are you there on the line?
Yes, I am.
Aaron, thank you so much for joining. Whenever you'd like, you can start, and I'll begin your timer.
Thank you, Mr. Chair and the Board of Health, for the opportunity to speak to you about COVID-19 positive case notification in apartment buildings. Tenants live in a physical environment which is significantly different from homeowners. To undertake simple daily tasks such as picking up the mail or taking out the garbage, tenants must enter an elevator that is less than 2 square meters. Press a button that is being touched by all the residents, which could be hundreds of other people, walk through common space with 2 or more doors, touch the door handles that have been touched by all the residents before reaching their mailbox or disposing of their garbage, and repeat the process to return to their apartment unit. The routine just described becomes more stressful as the Ontario state of emergency enters its 52nd day. The situation is completely different from homeowners who have total control of their physical environment. As long as COVID-19 remains widespread, it's important that tenants receive the information they need to protect themselves and their neighbors. As such, we have requested that when a confirmed case of COVID-19 occurs in a multi-dwelling residential building, Toronto Public Health place a notice in the building lobby informing tenants something like the following. Your building has 1 or more units where the residing tenant have tested positive for COVID-19. The affected tenants are currently self-isolating and will not be leaving their unit until Toronto Public Health has confirmed that they have recovered. Please take extra precautions when exiting and entering your apartment unit. If further information is required, please contact Toronto Public Health. Please note that this proposed notice does not identify the COVID-19 positive tenant in any way, and so does not infringe upon their privacy. Despite raising concerns with Toronto Public Health regarding notice of COVID-19 cases in buildings, their response has not changed. TPH is doing contact tracing on each COVID-19 case and will make decisions on how to share the information on a case-by-case basis. This is an unconscionable response. Tenants live in a congregate setting and deserve better protection from Toronto Public Health. TPH has never offered an explanation of why it's not feasible to place notices of COVID-19 positive cases in apartment buildings. The benefit of posting informative warning notices that impose no
Sorry, Aaron. We lost you for a minute. Do you want to keep trying? I've put your clock on hold while we wait.
Am I back on?
Yep, you're back on. I had paused your clock. You can start when you're ready.
Thank you very much. That have provided great value to the neighbors of the infected would seem to be self-evident. For the same reason, other warning signs, such as falling ice, buried gas line, and children at play are valuable public notices. It is with very deep regret that we note that Toronto Public Health preliminary analysis released yesterday suggests that people living in areas that have the highest proportion of low-income earners, recent immigrants, and high unemployment rates had higher rates of COVID-19 cases and hospitalizations. To better understand and strengthen capacity to address these issues, Toronto Public Health is adding sociodemographic questions to their case and contact tracking management process. Why is the type of residence of COVID-19 cases not included in the proposed additional sociodemographic questions? The preliminary analysis of TPH only strengthens the argument that residents of apartment buildings needs to be aware of positive cases in their building, as the majority of these subgroups live in apartment buildings. When the first wave of COVID-19 is over, a comparison of the positive cases in private residence versus apartment buildings will determine the validity of our concern. Let us hope that there will not be a COVID-19 outbreak in any apartment building in Toronto.
Aaron, just a heads up, you have about 20 seconds left.
I'm through. Thank you.
Thank you very much, Aaron. I'll now turn it over to the board. Again, if you want to unmute yourself if you have any questions. Okay, hearing none. Aaron, thank you so much. Appreciate it. Our second last deputant is Helen Chillas from 1501 Woodbine Tenants Group. Helen, are you on the phone?
Yes, I am. Good morning.
Good morning, Helen. You can start when you're ready, and I'll start the clock.
Yes, good morning. My name is Helen Chillis, and I am a tenant right advocate and chair of our apartment building tenant group, and also a member of the city's Public Advisory Committee on Affordable Housing. Today, though, I'm speaking as a resident who calls our great city of Toronto home. Firstly, I would like to thank Toronto's Board of Health for everything you do, helping to keep Torontonians healthy and safe during this most unprecedented time. Thank you all. COVID-19 has created a new normal. Businesses closed, people on lockdown, while our essential frontline workers, our healthcare professionals, and our public servants work tirelessly to keep all of us healthy and safe. Thank you. Toronto's Board of Health makes critical decisions to ensure public health and safety comes first and foremost. It's a great mantra, but with every approach, gray areas remain. It is inevitable, most especially during a worldwide pandemic, which will forever define who we truly are by how well we treat those most in need, our vulnerable, our homeless, our disabled, our seniors, and the hundreds of thousands of Toronto's residential tenants living in congregated housing settings, apartment buildings. At the beginning of the pandemic, Toronto Public Health stepped in and began releasing guidelines for landlords of apartment buildings. Physical distancing posters were produced, disinfection recommendations released, and therein lies the gray zone. Recommendations and guidelines are merely suggestions. Landlords are left with determining how to apply these recommendations and guidelines. Self-regulation rarely works at the best of times. That is why provincial laws are written and municipal bylaws follow. During a time of crisis, we must never forget that existing laws cannot be put on the sidebar. I have been connecting with hundreds of residential tenants across our great city and vast province. At the top of people's concern is paying the rent and putting food on the table. Many continue to experience elevated levels of anxiety and stress. Mental health is a public health matter. Many tenants are also very concerned about the health and safety of their homes. Homes which they rent, their living environment controlled by their landlord. After decades of advocating for tenant rights, this inequality led to the creation of the Rent Safe program and the Apartment Buildings Chapter 354. Yet today, during our most critical juncture, during the pandemic, municipal licensing and standards rental enforcement has come to a standstill. Tenants understand they need to wait for repairs. They are now in COVID-19 lockdown, but worrying about whether their landlord is following public health guidelines in apartment buildings is out of their control. MLS has stated that the city is communicating directly with landlords, urging them to adopt new public health and safety measures. Tenants, however, are left out of the equation. Who is communicating with tenants? Tenants who pay their fair share of property taxes, some even paying as much as almost 3 times more than the average homeowner. This is not new. Tenants are sadly often an afterthought. Tenants continue to report cleaning plans approved by MLS have not been adhered to. Disinfection practices remain in the hands of landlords' discretion. Staffing levels mostly remain the same. Some landlords are claiming more cleaners have been hired, yet we are still waiting. In fact, cleaning levels have decreased in many apartment buildings throughout the city. Tenants also worry about who exactly is training cleaners in disinfection best practices. Cleaning and disinfection are not the same. Tenants also worry about how landlords are actually maintaining good housekeeping levels, in addition to disinfecting every single doorknob, elevator buttons, stairwell rails, taps and sinks, garbage chute doors, laundry machines, counters, front door entrances, call buttons, automatic door openers, and the list goes on and on.
Helen, you just have about 25 seconds left as a heads up.
are reporting reduced cleaning services. Tenants are left wondering, worrying, stressed about their family's health and safety. Water shutdowns are a constant revolving door in older buildings. Now, during the pandemic, tenants are left worrying and stressed about washing their hands and disinfecting their homes. Our first line of defense to help stop the transmission and spread of COVID-19. In my building, we have had 4 water disruptions over the past 10 days.
Helen,
Yes,
I'd just
4.
ask you to wrap up in a sentence. You're just over 5 minutes.
Okay. We're also concerned about elevator overcrowding, signage. Now is the time. Businesses are slowly reopening. Parks and trails will be available for our enjoyment and exercise. People will be coming and going. Lockdown is starting to coming to ease. Hope is in the air. Tenants will be leaving their apartments more frequently. Such wonderful news. So much hope.
Helen,
But
I'm just
please
going
not
to
forget
ask you to stop there.
tenants
Sorry,
living in
we're well
congregated
over time.
settings.
Helen,
And that's all
thank
that
you.
we ask for. Thank you for all that you do.
Thank you so much. I really appreciate it. Thank you for sticking with us. Members of the board, if you'd like to unmute yourself and indicate if you have questions. Okay, hearing none. Thank you so much, Helen. And our final speaker on this item is Gil Penalosa from 880 Cities. Gil, are you on the line?
Yes.
Welcome. You'll have 5 minutes, and you can begin when you're ready.
Thank you. I want to thank especially Dr. De Villa, our medical office chief, who I met when she was leading the Peel region and was amazing. And I was extremely happy when she came to Toronto. So I'm very glad that she's leading, and I thank her for her amazing effort, as well as Councillor Joe Cressy, who we are really lucky that you have been leading the process through this period. I also want to mention that we have a dream team on the Board of Health, and I was very happy last year when it was appointed, and now, but because this team, the Board of Health, both sets health policy and addresses City Council on broad range of health issues, unquote. So in some ways, it's incomprehensible that you have not met for 4 months in the middle of this crisis. Maybe you have had lots of informal conversations, but nothing like the synergy of working together. With all respect, I think you should be meeting at least every other week for a couple of hours. And it would be the board would provide a fantastic sounding board for Dr. De Villa and for the city to move forward. I want to mention that I totally agree and support wholeheartedly every policy, and I think 99% of Torontonians do, issues like physical distance. No, there's no question on that. So I just want to make some suggestions briefly on the how, because we're going to have a huge mental crisis. LCBO, liquor, their sales are way up. Domestic violence is up. Pills for depression, anxiety are up. So we need to work on this. So specific recommendations. High Park now is closed. My suggestion is that while it's closed, to adapt the loop, the 2-kilometer loop, for 1 year pilot until maybe Canada Day 2021, so where the sidewalk will be to walk, the bike lanes will be for people running, and where the cars are on that loop will be for people cycling. It's doable, fantastic, easy to do, and it would be great for that year. Number 2, the quiet streets that Mayor Tory mentioned yesterday. I think it's a good start, but I also want to highlight that 50 kilometers is not enough, because Dr. De Villa is concerned about gathering. The only way of not having gathering is if we have this citywide. A city like Oakland has 130 kilometers. They did it in 24 hours. One day the mayor said, the next day 113 kilometers of slow streets. That is the same concept of quiet streets. And this is totally doable. I suggest to prioritize the areas with low park supply as well as the areas with high density. Next, bike corridors. For bike corridors, we need the essential services. People need to get to places now and in the period of transition. So we need connectivity. We need citywide. Let's keep in mind that cities that we like to think that are similar to Toronto, like Paris or Rome or New York, are doing more than 150 kilometers each. Toronto is very small. It's only 20 by 40 kilometers. We should have at least 3 east-west from Mississauga to the beaches and at least 6 north-south. So this is totally doable, but it has to be citywide. Otherwise, it will not work. So like Eglinton, Bloor, and King Queensway, and then 6 north-south. Next, I suggest to have open streets. We've had open streets, and with the huge support of Councillor Wong Tam, for the last year, only for 2 days a year. I think we should have it from now till October. Every Sunday, we should have Bloor and Young. Bloor from Mississauga to the beaches, and Young from the 401 to Lake Ontario. Have open streets. Funded, city funded. Is doable and people. So I just want to end by saying that this has been a horrible crisis. And I'm very happy that you have appointed an Office of Recovery with 2 fantastic people. Dr. Mowat is great, as well as Mr. Saad Rafi. And I think they should be bold. I think they have a very broad mandate. I hope they take advantage of this, because with all of the people that have died and all of the sacrifices by everyone in the city, the future has to be much better. We cannot go back to how we were 4 months ago. The future has to be more equitable, more sustainable, and healthier for all. So in order for the future to be better, we need to act today and in the process of transition that is going to be 12 to 18 months. So I thank everyone.
Thank you so much, Gil. Really appreciate it. Members of the board, if you could unmute yourself and indicate if you have a question. Councillor Wong Tam.
Yes, thank you very much. And thank you, Gil, for your presentation. I hope everyone can hear me properly. Gil, I understand that the other cities have somehow been able to sort of magnify the responses around opening the streets. In the city of Toronto, we've heard that we have some limitations with respect to staffing levels, that transportation services. I recognize they're not here to add to my comments, but there has been expressed to us as councillors and probably to directors here that we couldn't necessarily do it because we just don't have the resources. How were those other cities able to move forward so quickly?
Well, thank you very much, Councillor Wong Tam. And by the way, I want to thank you also for your constant concern for equity, because you continue focusing on, and we have big problems of equity. But regards to the streets, you don't need a lot of people. You need almost nothing. I mean, Oakland did 113 kilometers in 24 hours, over 70 miles, Oakland. By the way, Oakland has only 20% of Toronto's population. So when they're doing 113 kilometers, that means that maybe we should be doing 500 kilometers. This is what is quiet streets or slow streets. It's a simple concept. There should be no through traffic on neighborhood streets. So you close the through traffic, you only allow local traffic, but at only 15 kilometers per hour. Very slow and only local. So people can go out and walk and run and do physical activity, keeping physical distance. New York is doing this similar, more than 100 kilometers. And what is New York doing? Initially, they did a sample with lots of police, and it was horrible. It didn't work. Now they have done 40 miles, which is about 66 kilometers, almost with no police. It's just putting pylons and posters. I think we need to trust the citizens. I think one of the things that citizens have hated from the process is the barricades on Hyde Park, because it's so aggressive, and I'm sure that 99% would have obeyed with just putting some posters. So it's really simple. We could have used all the pylons that have gone on Hyde Park to do Bloor as a bike corridor from to beaches. So it's very low intensive in people. I think we also have 70% fewer cars. So and people are in the mood that people are respecting. So I think it's lots of pylons, lots of green, lots of yellow tape, and that's how these cities are doing it.
I just have one follow-up question with respect to the health benefits, because I think that there's been lots of, obviously we don't want to send the wrong message to say you should come out and congregate in these spaces, because that's not that would actually undo all the hard work and personal sacrifices of Torontonians in the city, and we won't be flattening the curve. But what are the other health benefits of actually creating the additional space for people? Can you just remind us what that would be? And how does that relate to issues around mental health, domestic violence, and just social well-being and social cohesion and breaking of isolation?
Oh, that's a critical point. They are not doing this as a mobility, as a priority. Number one is health issue. It's how to deal with physical, with mental, and emotional health. All of the indicators in all of the cities that have lockdown have shown that domestic violence has increased. In London, in the UK, they are arresting more than 100 people daily for physical violence. In Toronto, we have the hotels for physical violence. And a lot of this is when people, we need to remember that lots and lots of citizens, huge, probably over 1 million people, live in condos that are very small, might be 500 square feet. And we have families, and people used to go outside. When you live in small condos, you almost don't live there. You sleep there. You live outside, on the sidewalk, on the street, on the parks. So all of a sudden they are confined, and it becomes a huge crisis. So one, people need the physical activity. And two, the physical activity alone improves mental and emotional, and that is one of the reasons. That's why we see the World Health Organization today is promoting people to go out and walk. The medical officer of British Columbia is saying, please go outside. The risk of catching a virus outside is infinitesimal. We must remember that most of the people that are dying or the crisis are in long-term homes. Mostly also because of bad management, that we had employed people that were 2 days in one, 2 days in another, 2 days in another, and then we're carrying the virus. But the medical officers in many places are saying that it's infinitesimal probability of someone catching it on the parks. And also, this is not going to be for 1 or 2 months. Now we know that it's going to be for 12 or 18 months. So in this process, I think, in addition,
Gil, I'm just going to ask you to wrap up in a sentence as we're well over 5 minutes, please. Okay, thank you. Those are questions from Councillor Wong Tam. Does any other members of the board have any questions? Okay, hearing none, and welcome to Board Member Sue Wong, who has joined us as well. So thank you to all our deputants. That concludes our deputants. Thank you again to clerks for working so hard. We were the first to try this out, and I think it shows that it works. So we're now going to move on this item into committee. This is where we're going to open it up to questions from committee members for staff. Again, we have Dr. Davila, Juliana Carbone, and Maryanne Bedard here. Could I ask at this point if you could unmute and indicate if you will have questions, and I will start a list. So if you just want to unmute, I see raising a finger, Kate Mulligan. Actually, I can see your hand. So Kate, does anybody put up your hand if you don't have questions? Okay. So Angela, Ida, and Sue. So I have everybody else. Okay, we're going to get started then. I'm going to work my way from bottom to the top on my screen. And so in no particular order, I have Councillor Layton followed by Councillor Wong Tam. Councillor Layton, you're first.
Sorry, I don't need to ask any questions. That's fine.
Okay. Councillor Wong Tam, you're up first.
Thank you very much again, Mr. Chair. With respect to the testing and the speeding up of testing, there was an announcement made by the Premier that this was supposed to be in the hands of the local health units. Local health units all pushed back and said, no, this is coordinated by the province. Where did that conversation end up? Did we find a resolution to that?
So through the chair, testing is firmly within the purview of the province. That is something that they have been responsible for. With respect to testing in long-term care in particular, which is where I think the questions arose, local public health has stepped in to support the activities along with acute care partners. And we are happy to support, even though this isn't within our regular purview, just given the circumstances.
Thank you. And for frontline workers who are working in city-funded but perhaps not city-operated shelters or drop-ins, those organizations that are still remaining open, a lot of food handling type of food bank organizations, they have written a letter asking for PPEs, and they're being advised that they need to go through the province, and at the same time, once they get to the provincial level of communication, it goes quiet. What can we do to support, especially the downtown East service providers who specifically flagged that they need PPEs? What can we do to support them, even though necessarily it belongs to the province?
Responsibility. Chair, hi, Councillor Wong-Tam. SSHA did provide additional funding to the shelter operators, so they have some resources, financial resources to purchase PPEs. We are working through the EOC to make sure the province understands the need, and hopefully we can help meet that supply. And Maryanne might be able to augment.
Thank you. Yes, Councillor Wong-Tam, I am happy to let you know that as of yesterday, we made an announcement that we would be providing masks to all shelters for frontline staff. It's about 35,000 masks a week, and we'll start distributing those in the next few days. Even though that is above and beyond the public health guidelines, we did want to recognize the importance of frontline workers and also the vulnerability of shelter clients. So we will start distributing that to shelters. In terms of other community agencies, through our EOC, I know that they're working very hard advocating to the province for them to provide PPE to community agencies. And that discussion started many weeks ago, and that discussion continues.
Thank you. Probably just a follow-up question, since we're talking about the provincial responsibilities and who's coming in to help. With respect to the response to trying to create physical distance for those who are living in congregate settings, oftentimes in shelters, trying to move people into safe accommodations, whether it's hotels or private units. What type of support, if you can be very specific, have we received from the provincial and federal governments? And is that support enough? Because from the outside, it almost looks like the city's doing most of the work, and we don't have certainly all the resources.
Yes, so through the chair, Councillor Wong-Tam, we have received some financial support from the federal and provincial government. We've received $21 million from the federal government and $39 million from the province, which is very much appreciated. However, the response that we have put in place to adequately respond to the pandemic, if we maintain this to the end of the year, is going to cost in the region of $200 million. So as you can see, the level of funding we've received to date is not adequate to meet the need. That's also operating money and doesn't provide us some support to use this as an opportunity to have capital money to purchase properties for long-term solutions. So we continue to have those discussions at the provincial and federal level to encourage our partners to come to the table with additional operating, but also more critically, the capital money for long-term solutions.
Thank you.
Councillor, we're just at 5 minutes. We'll go through the first list with speakers, with questions, and then see if people want additional rounds, if that's okay. So I'm working in reverse alphabetical order here. So our next director for questions is Peter Wong, who will be followed by Councillor Perks. So Director Wong, I'm going to turn it over to you. And Councillor Wong-Tam, I know you're going to take the chair for a few minutes if you want to start your timer when Director Peter Wong begins. Director Wong, when you're ready. Oh, he has stepped off. I see he has just stepped off. So we're going to move then to Councillor Perks for questions, followed by Director Mulligan. Councillor Perks, over to you.
Thank you. My first question is for the medical officer of health. In the advanced circulated motion from Councillor Cressy, Part 11 speaks to the need to achieve global best practices for testing capacity. Could you describe for us what some of the global best practices for testing capacity are, or give us some thoughts on that?
Sure, thank you. And through the chair, I think a couple of things that need to be considered when we're talking about best practices for testing. Certainly a more, testing that actually covers the entirety of the population and gives us a sense as to disease transmission throughout the community would be one element, and having sufficient turnaround times, having better reporting mechanisms from laboratory, very timely reporting mechanisms from the lab to us at local public health so that we can affect our actions on an as-needed basis. And I'm just trying to think through. Certainly we know that what we also want to have is that the testing in and of itself is the easy part. The challenging part is making sure that there are viable pathways for those who are actually tested in order that they can comply with the appropriate recommendations, either to isolate or quarantine as the case may be. So I think those are the key elements when we're talking about what makes most sense and what is optimal in terms of testing.
How close are we to being able to achieve those?
Well, testing is under the provincial purview. So I know that our provincial counterparts are exploring many possibilities, and certainly we're pushing on a number of those aspects. We are actually piloting a number of initiatives with our labs and with assessment centers to see if we can bring down the time from notification of a positive test to having that result in our hands in public health so we can then do the appropriate follow-up. I think there are also some conversations that are continuing to progress in respect of how we create those pathways for individuals who test positive and those who are at high risk of becoming positive. There's still much work that needs to be done, but there is time for us to be able to effect better strategies and solutions, particularly as we expect we're going to be living with COVID-19 for many months on a go-forward basis.
Thank you. I'm not sure who can answer the next question. We've been given some presentations about actions taken around the shelters and long-term care homes. There's some other congregate living situations that I haven't heard as much about. I'm thinking here of personal care rooming houses, group homes, supportive housing, for-profit rooming houses. Wondering what work we are undertaking to try to make sure that we don't have outbreaks in those congregate settings.
Through the chair, and I'm just realizing I need to look this way and not look at your picture, Councillor Perks. So yes, those are also very important congregate settings. Unlike shelters, where the City of Toronto is the service system manager with direct responsibility for that system, those congregate settings are under the purview of the province. However, we do continue to try to support that sector with the issues that they're facing. We're having conversations with them regarding recovery opportunities for people in congregate settings who test positive for COVID-19 and providing them access to our recovery sites. And we do include that important element in our community base table with organizations that support the broader community. But specific to those locations, they are under the purview of the provincial government.
Councillor Perks, do you have any further questions?
To that, while I appreciate...
Councillor, could you... We're having a technical glitch here for a moment. Just hold tight for a sec. I did put your time on hold. We're back up and running. Do you want to repeat again that question? Thank you.
Sure. As a follow-up to that, while I appreciate that the licensing of these facilities is a provincial responsibility, my experience is that direct delivery of supports, protective equipment, inspections, that kind of thing, the province doesn't have the infrastructure to deliver those necessary supports to these kinds of living circumstances. Are we with the province where we would ask them to provide us with resources because we have that infrastructure?
Through the chair, Councillor Perks, yes, I mean, it is very difficult for them, lacking the infrastructure to provide that role. We would be more than happy to support those actions if the province were to provide us with those resources. As I said, we continue to have those discussions at the provincial level. We continue to advocate for the sectors at large, and we will continue to have those conversations.
Thank you. Councillor Perks, that was your questions. We'll come back at the end of the first run through to see if people have a second round. Our next, in reverse alphabetical order, is Director Mulligan, followed by Councillor McKelvey. Over to you, Director Mulligan.
Thank you very much, Chair, and I want to convey my deep respect and thanks to Medical Officer of Health and city staff and Toronto Public Health staff for all the work that you have been putting into this COVID-19 crisis over the last several months. I do have some questions about data in particular, and I was very struck, Dr. Davila, by your tale of two COVIDs and the inequities in impacts of COVID that we are seeing in our city. So I'm very pleased to see the commitment to start collecting disaggregated sociodemographic and race-based data. I'm wondering if there are also plans to include indicators like gender identity, sexual orientation, disability, or language into this data collection.
So through the chair, I can't be certain on every aspect that you've just raised, but certainly happy to bring it back to the team.
Thank you. I think those are some other important measures that we've been hearing are important for data collection and are doable. With respect to data again, with congregate settings, including those apartments and rooming houses and other kinds of congregate settings, are there plans to disaggregate these data in daily reporting so we get a sense of where outbreaks are occurring?
So through the chair, certainly some congregate settings, actually most congregate settings, we are actually separating out the data so that we are providing that sense to the public, and perhaps, on a more immediate basis, also changing our actions and adapting or adjusting our resources depending on where the situations require those resources to be deployed. So yes.
Thank you. That's really good to hear. I was wondering if you could also clarify what the role of Toronto Public Health is vis-a-vis the province when it comes to deciding where to prioritize testing or to prioritize allocation of personal protective equipment and infection control procedures. I know that you've mentioned that it's within the purview of the province, but is there any discretion for the local health unit to prioritize those areas that you have demonstrated in your research are more at risk right now?
So through the chair, there is some discretion. Again, testing is still under the provincial purview, and there are very specific directives that they've provided to local public health around where testing resources and testing efforts should be prioritized first. And at this point in time, that's long-term care homes. However, there are circumstances that arise within the City of Toronto where there is clear health risk, and it's premised on those specific risks that we can, as the local health authority, direct resources specifically. So for example, in a setting, a congregate setting where there is a case or we have reason to believe that we should be suspecting an outbreak, we would clearly be directing resources towards there. When it comes to personal protective equipment, when it's a healthcare institution, it is clear that the province has purview over that. As the local public health authority, we actually do not have any direct control over personal protective equipment or its distribution.
Okay, thanks. So if there are shelters, for example, community run shelters or other congregate settings where there may be an outbreak, they could approach Toronto Public Health for support in accessing testing.
Yes, absolutely.
Also, okay, I want to go back to the data for a moment. I noticed that Indigenous identity is one of the indicators of interest, and I'm just wondering what practices are in place to ensure Indigenous data governance principles are followed with respect to ownership, control, access, and possession of these data.
So through the chair, I don't know that I can get into the granular level of detail that you might be interested in, but I can confirm that staff who are working on this data collection have been in contact and are continuing to have conversation with, whether it's through the, we have a variety of Indigenous partners who are offering us guidance, particularly those who have been involved in our health counts. I know that they've provided some guidance to us in respect of data collection principles. And certainly we have other venues through, for example, the Toronto Indigenous Health Advisory Circle members. So we are trying to make sure that our work is proceeding in an appropriate fashion through those regular connections and conversations with the relevant community partners.
Thank you. And Director Mulligan, that's just past 5 minutes. After we go through the first round, we'll come back to see for more questions, if that's okay. Thank you. So next up, we have Councillor McKelvey, followed by Councillor Lai. Councillor McKelvey.
Thank you, Mr. Chair, and thank you to all of the Toronto Public Health staff who've been doing an exceptional job. My first question is about, both questions are about data, and the first one might be better geared towards SDFA. So my question is, how are we collecting socioeconomic data right now that are showing where people are having the biggest changes in circumstances? Because the data that we have, it's old census data, and where people are in need will be changing throughout this pandemic. And I'm just wondering how we're trying to capture that data in real time so we can redeploy resources in a very different way.
Well, through the chair, I'm going to have to get back to you on the detail. I know that Denise and her staff through Harvey is working with economic development on a process for collecting that. I'm not sure where they're at, but can I get back to you later today?
No, that's great. And then my other question is about data, but probably for Toronto Public Health. And that question is about health related to COVID-19. So how are we looking at data around mental health? Are we looking at our suicides on the rise? Has there been an increase? Other
So we
hospital setting, how have we been capturing that data on other impacts that could be happening?
So I'm just going to, Councillor, your feed cut out for a second there. So I might just ask you to repeat the question. I've put your time on hold. We caught the first chunk of it. If you wouldn't mind just repeating it.
Thank you. So my question was, are we collecting data about other health impacts, non-COVID-19 related? So for example, mental health data, do we have data looking at suicide rates? Do we also have data about other health issues so that we can start to discern if people are being reluctant to go to hospitals for treatment and that's having adverse health effects also?
So through the chair, very briefly, we do continue to have an epidemiology function, and we will continue to receive data from the usual sources in respect of all other aspects of health. I don't know that we've had an opportunity to do significant analysis on that, just given our focus on COVID-19 at this point in time. But certainly, in the coming weeks and months, we will be looking at those data to understand what the fulsome impact of COVID-19 has been on our community in all the other aspects that you described.
As we look towards reopening, is there thought towards health services that should be prioritized? So for example, chiropodists and people going to physio or massage therapy for pain and pain management. So is that being, I know right now, for example, the province is looking at opening businesses, but are they also looking at reopening in a lens of, people are at home suffering because they're not able to get treatments that they normally do?
So through the chair, I can't speak to what specifically is happening at the provincial tables. I know they're discussing many aspects in respect of recovery. We certainly are having those conversations here through the recovery team. And I expect you'll hear more about this as our work on recovery and rebuild progresses. But certainly we are mindful of those issues that you raise.
Thank you. And thank you for all your great work.
Thank you so much, Councillor. Next, we have Councillor Lai, followed by Trustee Donaldson. Councillor Lai. Councillor Lai, you'll just need to unmute your phone. Sorry, Councillor.
Okay, now I'm good.
There you are.
I just
Great.
can't unmute my phone for a moment.
Thank you.
First of all, thanks, Mr. Chair. I'd like to echo the sentiments of thanks and appreciation to our public health team, led by Dr. Davila, as well as the city staff. And my first question is for Dr. Davila. Your slide in the presentation about the power of social distancing is very good because, I think just to combat this virus, we need to put social distancing in place. And there are reports to show that in the Maclean magazine, as well as in Australia, to show that wearing mask or any form of face covering would reduce the transmission probability from 70% to 1.5%. My question is that, would you consider exercising directives on mandatory wearing of masks in places where social distancing is impossible? For example, on public transit, on elevators that are crowded, in cinemas, in grocery stores. And if not, please tell me why.
So through the chair, I think that's an excellent question. And it's certainly an issue. Masks, the subject of masks has been one that has been discussed in quite a bit in public health circles. I'm going to summarize my comments on this issue to say that we know that there is what we call in public health this hierarchy of controls, and some methods are actually more effective than others. As indicated through the slide, physical distancing and respiratory hygiene, these are the mainstays of reducing transmission of virus in our community. Those continue to be the most important elements. We basically say that when it comes to personal protective equipment like masks, that's the lowest end. And that's not to say it's not helpful. It's just the final stop, and it is something that we are actively considering. I can tell you that the current recommendation at the federal level is a recommendation to consider use of a non-medical mask in those instances or circumstances where physical distancing cannot be maintained. That is our current stance right now. I will say that this is an issue that is being actively discussed at public health tables across the country. We have tried to stay in lockstep with our federal counterparts on this front, and I think the entire country is trying to stay in lockstep on this issue. So I expect we will be hearing more and more about this in the coming days, and that you may be seeing a slight change in the recommendation. I think we are seeing around the world stronger and stronger recommendations around the use of non-medical masks where physical distancing cannot be maintained. But first and foremost, physical distancing is considered the most powerful method.
Yeah, thank you very much for that answer. Because I held the town hall yesterday with the mayor, and then my constituents are asking the same question, and the mayor was saying that he will follow the guideline of the public health medical office of health. So that's very important that we take that into consideration. The second question I'm asking is about mental health. I think mental health is a public health matter. What steps, if any, is the city taking to combat racism and xenophobia that some of our residents are being encountered as a result of COVID-19?
So through the chair, I think certainly early on in the COVID response, there was a significant amount of activity that was happening here at the city and within public health in order to combat racism. I will say that over the last several weeks, given the focus of our activity on case and contact management and managing outbreaks, that has probably been less so a focus of our activity in the last little while. That doesn't mean that we've forgotten about that. So clearly, we are trying to provide information to people in a way that supports the ability of our community to make good choices around their health, while at the same time ensuring that we don't do anything that promotes stigmatization or discrimination against any particular group. Those efforts will continue, but happy to hear from you on what advice you would have for us.
Thank you. My last question is that are we having a conversation with the province on the work they will be doing to protect our children or to support their parents from COVID-19 when the school reopens? Are we having that kind of conversation with the province?
So through the chair, I can tell you that we are participating on a provincial table called the Public Health Measures Table. The issue around schools and congregate activities for children is one that's on the table for discussion, still in its early stages, but that is clearly a primary concern for us and the rest of the province.
Thank you.
Thank you, Councillor. Next up, I have Trustee Donaldson, followed by Director Bowery. Trustee Donaldson, when you're ready.
Thank you, Chair. I also echo the thanks from the bottom of my heart, and it's also wonderful to see all of your faces today. I have a couple questions. Building on Councillor Lai's question about schools, my first question is about school reopening, and my second one also about mental health. So I've been watching what's happening in Quebec and also what's happening in Montreal, and I have some concerns about this reopening. And I also note in your slide deck under the recovery phase principles, one of the key principles is avoiding the reversal changes if possible. So my concern is about the treatment for Toronto schools, and I know that the direction comes from the province, across the province, for school reopenings. And I'm wondering if Toronto needs to be closed for longer, how we make that happen, and maybe more specifically, Dr. Davila, if you can clarify what your powers are related to schools reopening and what measures need to be taken there to protect students and staff and families.
So through the chair, as I mentioned, there is a provincial table at which we are represented that is specifically discussing public health measures, and that does include discussion around how best we protect our children. And clearly school would be an important component of that. You're quite right. The decision around schools and their reopening, and in fact the decision around their closing in the first place, was one that happened at the provincial level. And we do indeed have unique circumstances here in the city. Even as we engaged in the COVID response, we knew we had unique circumstances in the city. And we had pretty fulsome discussion here with our legal counsel around what sorts of powers were available to me as the medical officer of health in order to control the impact of COVID-19 and to best protect the city. It's clear to me that there are some powers that I'm able to exercise. They are not as broad or as wide-ranging as perhaps we would like them to be. So I think that really the resolution on this front will require significant interaction with the province and careful explanation as to what the circumstances are here in Toronto and why certain actions may need to be different. And that may not only be about schools, it may be about other realms of activity as well.
Thanks very much for that answer. That really clears things up. And my second question is, in general, what's the role that mental health promotion plays in the public health effort to manage through the pandemic and obviously to recover from it. And in your estimation, is Toronto Public Health set up with the resources, the funding and the human resources that are needed to be able to mount the type of mental health promotion effort that will be required for us to recover from this pandemic successfully?
So through the chair, I think there will be significant efforts that are required on the mental health promotion front, and they are not exclusively within the realm of Toronto Public Health. So I know that we will be reaching out to many other community partners and other partners at, here at the city. I would suggest that right now, the effort at Toronto Public Health has been focused, as I'm sure you can appreciate, on COVID-19 response. As we start to move into the realm of recovery, still keeping response activities active, we also will be starting to look at how do we return to provision of those necessary public health services that are not related to COVID-19 per se, the COVID-19 response, but involve our mental health promotion. But this is not something we're going to do alone. We will be doing that in partnership with our other city partners and other agencies throughout the city. So stay tuned, that is coming.
Okay, thanks a million to everyone for everything.
Thank you, Trustee. And for the first round, I believe our final questioner is Director Bowery. When you're ready.
Hi, it's lovely to see everybody. And I want to say a huge thank you to Dr. Davila and the entire Toronto Public Health family for your guidance and your leadership. As a healthcare provider myself, I can say that your guidance and leadership has been the only constant through what has been a very uncertain and turbulent time. So thank you. The best part about going last is that most of my questions have been answered already and answered well. I do have one small question to ask, and that is, as the warmer weather approaches, usually we'll see typically many vulnerable patients in the city seek refuge in cooling centers. And I'm hoping that we will get warmer temperatures soon. So in the recovery phase, has there been any planning and consideration around this?
So through the chair, one, I will echo your wish for warmer weather. I think many of us are hoping for more spring-like conditions. But when it comes to heat relief, there has been significant conversation, and in fact, even prior to COVID, we at Toronto Public Health were having conversation with our partners in the city. This is a function that will be largely assumed by our colleagues in the Resilience Office. That doesn't mean we're not going to be engaged. I think this is, as are many activities that are done here at the city, a concerted effort and a collaborative effort on the part of several of us across many, many divisions. So this is on our minds as we approach recovery. Specifics, I think, have yet to be completely worked out, but suffice it to say that we are thinking about it, and we do know that there are some good plans in place, just need to make sure that they're appropriately adapted for COVID-19 and what we know about our response and what's needed now that we've got this experience of the last several weeks under our belt.
Anything further, Director Bowery? You're on mute.
No, thanks. All set.
Okay, thank you. So that takes us through the first round of questions. What I'd ask, and I'm looking at the screen, is if you could raise your hand if you would wish to be put on. Oh, our screen has frozen for a moment, so just hold. So what I'd ask is if you would wish to be if you have a second question. I see Councillor Perks, Director Mulligan, anybody else? Councillor Wong-Tam and Director Wong. Okay, so I'm going to begin with Director Wong, followed by Director Mulligan, and then Councillors Wong-Tam and Perks. Director Wong, when you're ready.
Thank you very much, Mr. Chair, and thank you to the staff, beginning with Dr. Davila and the entire public health team to lead us through this round of COVID-19 pandemic. I didn't hear in our presentation, both from Dr. Davila and the city staff, the deputy city manager, regarding the most recent concern by the taxi industry, Mr. Chair. Any cases?
So, Director Wong, your mic is just cut out. Do you want to hold tight? And I'm going to ask you to repeat the question again.
Let me see if my mic is this on.
Yeah, we have you now. Do you want to start again? No, you've mute. Sorry, Director Wong. There, you're back.
Okay, so let me see.
Okay.
It's very sensitive. We good?
Okay, start again. We're ready for you.
Okay, thank you very much, Mr. Chair. I want to thank the city staff, beginning with Dr. Davila and the entire public health staff to lead us through this COVID-19 pandemic. During the presentation, both the Chief Medical Officer of Health, as well as the Deputy City Manager and the manager dealing with shelters, I didn't hear any information about the taxi industry, because we recently heard about what happened in with the limo drivers. So what measures, do we have any cases? Do we have any incidents of COVID positive taxi drivers in our city to make sure that we as an advocate board, a public health board, can be advocating for them as well to make sure that this particular sector is extremely vulnerable. Yes, it is a private sector. I want to hear, are there any data about this particular sector?
So through the chair, I don't have that specific information in front of me. I can certainly take that back to staff and see what information we have on cases within the taxi industry and those who are driving limos and the like. Certainly we have, first of all, some guidance that's been provided in respect of protecting oneself and how best, even in the face of providing transportation to individuals who are known to be COVID-19 positive, how to create the safest environment possible for those who are providing that driving service. And as well, we know that our Emergency Operations Center actually has a working group with representatives from the taxi industry to understand how best we can provide supports, ensure that the appropriate transportation needs of our city are being met, while at the same time working with the taxi industry as in their role to ensure that health and safety of those who are providing those important transportation services are being balanced out as well. So that's where we're at. We do have, again, ongoing assessment of risk, and we try to update our advice on our information and the circumstances as we see them.
Thank you. Mr. Chair, I have some questions dealing with the motion. Is this the right time to ask a question?
No, the questions related to the motion would be at the time that I move it. Thank you.
Thank you.
Okay, thank you very much. Our next is Director Mulligan. And I see that the youngest member of our board has joined us. There is a child on the screen, also a first for the city. Welcome, Chloe Layton. Sorry, back to Director Mulligan.
Hi, Chloe. And I just have two further questions for you, Dr. Davila. One was that I've heard that some of the cities recovery centers for people experiencing homelessness who have been diagnosed with COVID have also been used by people from outside of the Toronto area, in the Greater Toronto area or in other areas. Is this the case? And if so, has there been funding in place to support that?
Through the chair, thank you for the question. So the access to the recovery sites is managed through our partnership with the Inner City Health Associates. So when somebody tests positive, they are referred to our medical partners, and they provide approval to come into that recovery site. Right now, we're using that recovery site for anyone that is currently a resident of one of our shelters. I don't know if somebody in our shelter system necessarily has come from another region, but on referral to our recovery centers, they will be a current resident of one of our shelters.
So we've just had a technical hold up for a moment. We're just rebooting, so we'll hold tight for a second. So my apologies, everybody. Just continue to hold. And we have you back. Director Mulligan, did you hear the response to your question?
Yes, I did.
Okay.
Thank you.
Great. So back to you. I put your time on hold while that was happening.
Okay. I just have one further question. It's about long-term care. And Dr. de Villa, I was wondering if you could share what is your current advice for families and friends who, prior to restrictions on accessing city-run long-term care facilities, provided essential care services to people in long-term care. So these are people who are now alone and living without some essential support that family and friend caregivers provided with respect to feeding and other essentials of daily life, in addition to companionship, love, and support. And so I'm wondering what your current advice is to those caregivers, and are there opportunities to treat those caregivers as part of the healthcare team in those facilities and allow them in under strict,
So through the chair, can you folks on the line hear me? Just making sure. Are we okay? Are we up? Okay. So through the chair, with respect to long-term care, so long-term care is, as you know, under the provincial purview. It has been traditionally managed under the Ministry of Health and Long-Term Care. That arrangement shifted mid last year with the establishment of the Ministry of Long-Term Care. That being said, those environments are still seen as part of the healthcare system and therefore are under provincial jurisdiction. And right now, the access to those sites is restricted under a provincial directive that basically does not allow for anyone who is not seen under that provincial guidance as essential to being in the home. Anyone who's deemed non-essential is not allowed in the home right now. I know that this is a subject of conversation at provincial tables. So I expect that they will be reviewing their stance on this issue, trying to manage both the concerns around COVID transmission within the long-term care settings, where we know it's been a very serious and severe impact that COVID-19 has had on long-term care residents and their staff. But we recognize, and I think there's widespread recognition, that the optimal health of those who reside in long-term care settings is about protecting them from COVID-19, but also ensuring that they have access to a broad range of supports. So right now, that's under conversation, and it is under provincial purview, and I am happy to raise those issues with our provincial counterparts.
Thank you so much. That's very heartening to hear. I actually do just have one more question, Chair, if that's all right.
Yes, please. You're still within your time.
Okay, and this is about going back to screening when we're asking questions about sociodemographics and so on. Has there been any conversation about screening for social needs, making referrals for social determinants of health during this time, given that we know how critical housing, food access, mental health, and other conditions are during this time of COVID-19? So what has been put into place with respect to social screening and referral?
So through the chair, I'm not aware of current publications in this regard. Certainly, we are, as the local public health unit, interested in understanding the fulsome aspect of COVID-19 on our community. The infectious disease aspects are certainly one component of the impact. We are absolutely interested in understanding the broader health impacts of COVID-19 on our community and how that might affect referral patterns and what sorts of services are now needed as we move from response to recovery. So I don't have specific information at this point in time, but please know that that's part of our consideration and certainly part of our thinking and planning as we move from response to recovery.
Thank you very much.
I have no further questions.
Great, thank you. Next up, I have Councillor Wong-Tam, followed by Councillor Perks.
Yes, thank you. My question, I should say, is for Maryanne Bedard and the work that she's leading her team through around the homelessness response. With respect to the shelter standards, currently they sit at just under 1 meter in terms of separation space, 0.75 between sort of bed facility and how much space someone needs to have to the next mat or bed. And I know that in respite centers and drop-ins, they don't necessarily have the shelter standard, but oftentimes they function like a shelter. Moving forward, knowing that we're probably going to be reevaluating just about everything that we do at the city. Is there a need to reevaluate also those standards, shelter standards around separation based on what we now know around physical distance and how infections can be transmitted?
So thank you for the question. Yes, I mean, I think as Juliana referenced, this is an amazing opportunity for us to review all of our standards and look at lessons learned. The respite standards do encourage the same distancing between beds as the shelter standards. But as you've identified, it is less than the 6 feet required during COVID-19. But it's absolutely part of our recovery strategy to look at where were the gaps before we experienced COVID-19, how did that play out during the pandemic, and how do we want to use that information to think about the system going forward. So those are very much topics that we will be discussing and looking into and looking to make some changes going forward if possible.
Thank you. Just a follow-up question with respect to trying to get everyone who is either street involved, sleeping open under the sky, or who is currently in the shelter system. What is the estimated time frame, do you think, in terms of the runway of work that still needs to be done until we get everyone into some type of indoor accommodation or inside place? Are we looking at another month of work that's before the team at SSHA? Is it another 2 months? Give us a ballpark.
Councillor, that's a complicated answer to provide. We are continue to work daily with people who are staying outside. And trying to make space available to them. Obviously, it has been difficult as we've been working very hard to create physical distancing in the shelter system to enhance our shelter system. And so we've been looking at specific programs for people in encampments. And as you know, we opened up an interim housing program last week with 125 units. We have over 100 people there now, and the second building will be coming online next week. Not everybody in an encampment is in a position to accept an indoor placement, and that is why the Streets to Homes program is so important. They continue to link with people in encampments, to develop relationships, to build trust, to provide support in, getting ID and healthcare and, various services that they need while they're staying outside. And then obviously part of that relationship development is also talking to them about what are the conditions under which they would agree to come inside and how can we best meet those needs. But as far as...
Do I have time for one?
Yeah, sorry. As far as a timeline, we're working on a daily basis to bring as many people as we can inside with the availability of the space that we have. So I can't give you a timeline. I can tell you that we've achieved physical distancing in 95% of the shelter system. We're just in the process of verifying that. Those have been reported to us, and we're involved in doing quality assurance visits now to go out and check that.
And yes, Councillor, you have time for one last question.
Okay, my final question is just coming back to the relationship and supports that we've received from the provincial and federal government. Recognizing that once a facility is secured by the city, it seems to be somewhat quick to be able to move people into those facilities. I mean, we have to get it furnished, we've got to build the staffing support models. I'm just curious to know what specific supports have the provincial or federal government offered to us as the City of Toronto in a response to addressing and trying to support the homeless population. Besides the $39 million and the $21 million, which we know money is not everything, but is there any other support that they've offered?
In terms of just the homelessness sector, they have provided us with funding, as you mentioned. The other thing that the provincial government has provided us with is support from our healthcare partners. So they've been directly funding the inner city health associates who work in our recovery and isolation programs, and so that's been a tremendous help to us. But that's the support that we have received, and I'll ask Juliana to talk about anything broader.
Hi, Councillor. And also the federal government through CMHC has stepped up and provided funding for modular housing. So they've committed to help us fund the 110 units for 2020 and the 140 units for 2021, which is going to be a very important part of not just sheltering people, but actually getting them housed.
Thank you. Next, we have Councillor Perks, and then our final questioner is Councillor Layton. Councillor Perks.
Thank you. To Dr. Davila, we had a number of deputations this morning about the safe supply of hydromorphone or other tools. Can you tell me what steps to date the Toronto Public Health has taken?
So through the chair, we've put forward an application to the federal government for funding for exactly the programs and activities that were described by the deputants. I've had a number of conversations with partners at the federal government who have this within their bailiwick, and I remain cautiously optimistic, but optimistic nonetheless that we will have some success. So I keep your fingers crossed. There seems to be a great deal of receptivity at the federal government, and an understanding of the importance of the kinds of programs that we're asking for on safe supply. So do stay tuned. We remain very, very hopeful that we will receive good news.
And in terms of provincial government about putting it on the formulary?
So through the chair, I don't have specific knowledge around what's happening at the provincial government on the formulary, but happy to follow that up.
Any further questions, Councillor Perks? Nope. Okay, thank you. Councillor Layton.
Yes, thank you very much. My first question is to Maryanne Bedard. There seemed to be, in the early days, a time delay between when we announced that we had secured hotels and we actually started moving people in, and then it was quite slow moving people into those units. Can you describe to us what challenges there were or what steps were taken that may have led to delays in moving people into more isolated, socially distanced housing?
Thank you for the question. I wouldn't say that there were delays, because we actually implemented those services as soon as was operationally possible. So we did secure particular hotel programs with the hotel owners. After that, we had some ongoing discussions with our community agencies to identify if any of them would be able to provide the staff support. In some cases, those agencies needed some time to hire some additional staff. Obviously, these are new programs, and so they did require additional support. In the case of the city, we also needed to have staff redeployed from other divisions, and then we needed to train them for the type of work that they would be doing. While that was happening consecutively, we were securing contracts for food and linen and security and cleaning and all of the sort of supports that you need to run a program. Many of the hotels, although they leased us the rooms, they did not include any of those auxiliary supports. And then in addition, we also worked with our partners in fire life safety to do an inspection of each of the buildings because although they are licensed hotels, they may not have had their annual fire check. So we wanted to make sure before we moved people into those locations that we had confidence that the fire life safety was in place. So behind the scenes, there was a tremendous amount of work happening. And as soon as those things were put into place, we began moving people into those rooms. Additionally, that is also a complicated process of identifying people who are at highest risk, having conversations with them about where the offer of the hotel is, who the operator of the hotel will be. It's not always the same people that are providing support to that person, and what supports will be available at the hotel, what is the location of the hotel. So all of those things needed to be taken into consideration. But as I said, operationally, we moved people as quickly as we were able to into those spaces. And in just a matter of a few short weeks, we have over 1,000 people now in those hotels, which I think is a phenomenal job done by our community partners and our staff.
So I guess this is to Ms. Carboni about the federal support. Our shelter response clearly has involved has a significant price tag attached to it, and I believe this is money well spent. But has the federal government, beyond this money or some of the support that they're giving to the affordable housing side, are they providing some supports as we work through addressing our homelessness crisis through COVID?
So through the chair, we're still in discussions with both the federal and the provincial government. So all we have committed right now is that $21 million and the funds for through CMHC for modular housing. But the conversations have not ended, and there's a strong indication that they're willing to work with us. We have been advocating, and we're actually putting together a business case that we could submit on the importance of more permanent solutions and not just temporary shelter beds, and investing some of the dollars and monies that they're flowing to us for a temporary response on a more permanent basis, like capital dollars, so that instead of just leasing hotels, etc., if we have an opportunity to purchase them at a reasonable price, of course, then we can, after we get through this emergency, we can start converting those units to supportive housing, which will be a lot more economical for all three orders of government. And we've built that case. We're just summarizing it now.
Thank you. And if I do have any time left, I'd like to ask one last question to the medical officer of health, and that's about physical distancing on sidewalks. Just because this isn't an evolving set of recommendations, and we have had some time to see what's going on in other jurisdictions as they shut down their roads or part of the roadways, and what that has done to either facilitate or to facilitate physical distancing or attract more people to those spaces. Are there any early lessons that we can take from some of those other jurisdictions? Because I'm very eager to go down this road at your recommendation, of course, but wondering what we've seen in other jurisdictions are the positive or good guidelines to follow.
So through the chair, as you can appreciate, at the beginning, we were very focused on physical distancing, which actually meant for people to stay at home as much as possible. But as we move from response to recovery, we are learning how to live with COVID-19, as are many other jurisdictions, and this will include how we move about in our city in a way that's safe, that promotes that physical activity and the mental health benefits that come from more active transportation, while at the same time ensuring physical distancing. So, short version, yes, we are absolutely looking to other cities around the world to learn from them and avoid whatever challenges they may have already encountered. Always best practice to do that, certainly. And I know that we're working very actively with our transportation services partners to make sure that we're capitalizing on all the opportunities that present themselves to support active transportation, one, as part of living with COVID-19 safely, but two, we would like to see this become a more significant way of life in our city. We know that active transportation has a multitude of benefits. We know that how we live and move in our city has a myriad of health benefits for all of us. So please rest assured that this is an important issue as far as we're concerned. Yes, it has very specific resonance within COVID-19 and as we move to recovery, but we are taking the much longer view on this and aiming for active transportation modes to figure prominently. And yes, that includes public transit, cycling, walking, all the things that you would expect to see in a healthy, modern city, even as we live with COVID-19.
Thank you very much. Those are all our questions. So we're now going to move this into committee for speakers. Just a time check, just so people are aware, it's 12:15. We do have a scheduled recess at 12:30. Depending on the number and the length of speakers, I may propose that we seek to extend to finish. So just to get a sense, could you indicate by raising your hand if you wish to be put on the speakers list? Okay, I see Director Mulligan. Anybody? Councillor Lai. I'm putting myself on to speak first. Councillor Wong Tam. Anybody else? Okay, and Councillor Perks. Okay. And Councillor Layton. Okay. Let me begin, and I'll start my timer. I will begin by placing a motion that has been advance circulated by email to all of you and distributed publicly. I believe this sets the record for longest motion in the history of a city committee, and that is in large part in a result of a collaborative effort with so many members of this board. This is not my motion. This is a comprehensive motion that nearly all of you have contributed to along with our city staff. And so thank you for that. I do want to thank again our tremendous team here from clerks for pulling this together, members of city staff from Shelter Support and Housing Administration and Juliana Carboni, and to each and every member of this board for your relentless work over the last number of months. The first amendment that I have placed here is for City Council to commend Toronto Public Health staff. And that is, as we have all mentioned again and again and again over the course of this morning, because our TPH staff have been working flat out, and I counted, for 120 straight days. They have been meeting daily on COVID-19, before that the novel coronavirus, for 120 days. It has been long hours, it has been tough days. They have done it with the weight of the world and the health of our city on our shoulders, and they deserve our immense gratitude. Dr. Davila has talked about the two pandemics we face, both within the general population as one, but in particular the second, which is preying on the most vulnerable. Those who live far too often in congregate settings, and those who are far too often living in a low-income status. And so at all times as a city, we should measure our success based on how we care for the most vulnerable. And so too must we measure our response to COVID based on how we care for the most vulnerable. And there's a lot of work to do there. And the motion here in front of us speaks to that work that's still in front of us, both for the city, but in particular, some very clear and strong positions and requests of our other levels of government. For funding, yes, from the federal government, in particular around housing, but from the provincial government to increase testing and data collection and share the data collection, to provide increased support on our homelessness and housing response, including on safe supply, and to ensure that our long-term care and the workers in it reserve the support they need. But our response is just one part of our overarching piece of work in front of us. As was mentioned in the presentation, recovery is in many ways going to be the hardest part because we know how to respond. We have to spike this curve. We have to distance. We have to respond in congregate settings. We also know once we have a vaccine that we'll need to reopen, and reopen hopefully into a new and better and more fair normal. But this recovery phase is the hardest because it's the great unknown. And we're all learning in real time as cities, as public health units, and as countries around the world. But it's just as it's challenging, it is an opportunity. It is an opportunity to fundamentally not just recreate the status quo, a status quo that had severe health inequities that have been exposed during COVID, but rather to build a better city. And so over the next few months, that is the task in front of us, I believe, as the Board of Health. We've spent years, as those of us in public health, talking and advocating for the city, for the province, for the country, to tackle the social determinants of health. Often we're rolling rocks up hills, trying to desperately encourage others to tackle housing inequity and food insecurity and the overdose crisis. Well, now everybody's listening. We're making the same recommendations, but decision makers are listening. And so the task in front of us is to seize that moment, to build that better and more fair and more sustainable city, and to not miss this opportunity. Because if we do, we will recreate the same unhealthy circumstances that COVID has taken advantage of. With that, I'll pause and conclude my remarks. Does anybody have any questions of me on the motion? If so, you can unmute. If not, we'll move on to the next speaker. Okay, seeing none, our next speaker, thank you, is Director Mulligan.
Thank you, Chair, and thank you to all the staff and members of the Board of Health who have contributed to this motion. I want to offer my strong support for the motion, and in particular, emphasis on the social determinants of health and on health equity. We have seen the ways in which the pandemic demonstrates not only tale of two COVIDs, but also that care for the most marginalized person, care for all of us, and that we are all deeply connected, that we may not be in the same boats, but we are in the same storm, and that this interconnection is becoming quite evident. And I think this is part of the reason that this board is being heard, that these issues are gaining more prominence. So I'm very pleased to support. And I am impressed by the 120 days of hard work by Toronto Public Health, by our chair, by the staff across the city, and also want to note that it has been almost as long since we met, 115 days. And I'm really pleased to see us gathering here today. I think that it is important for us to consider what the role of a Board of Health is and should be, could be during a pandemic and as we move into a future of living with COVID-19. Our role is not and should not be to have the individual privilege of briefings or questions and answers. Should be a collective public service. It should be collective governance. And for those of us who are here as citizen members, this is really vital. We are here on behalf of our fellow residents of the city, and not part of all conversations about what's happening. And we want to make sure, all of us on this board want to make sure that the residents of this city are well informed about what's going on, and have strong access to the decision-making processes that are happening. So I really see us as being called to a collective leadership. So our role isn't just to receive information or ask questions, but also to provide all the board oversight functions and to make important decisions. And I think this collective motion that's before us really illustrates the power of that collective approach to governance, the kinds of contributions that a full board meeting together, meeting openly and transparently, hearing deputations really can bring to bear. And the good faith in which all the members of this board are acting, all the deputants are acting, and that the chair and the staff and everyone have shown really demonstrates something that, unfortunately, I think has been lost over the last 115 days. But it's not too late, and it's really, really heartening to see us here today. And, it would be good to keep that conversation going. The Ontario Public Health Standards set out what we should be doing as a board, what we're accountable for, and we need to live up to. But they don't set out clear guidelines about what to do in a pandemic. And people were very busy trying to cope with emergencies. And so let's take up the opportunity now that we have to live up to that, to think about what ought to be in those kinds of standards in the future, and to support the very strong measures about health equity and community well-being that are in this motion. Thank you so much.
Thank you so much, Director Mulligan. Our next speaker is Councillor Lai, followed by Councillor Wong Tam. Councillor Lai, do you want to unmute your mic? Okay, there you are.
Yep.
You're unmuted. You can begin when you're ready.
I don't know. I have some issue with the muting button. Anyways, thanks, Mr. Chair. Thank you very much. And I also like to echo Director Mulligan's sentiment. Not only we thank our public health team, and I'm actually very proud of our city and proud of our team that shows the leadership. And thank you for collaboratively work out this motion that we have in front of us. And I will support the motion, especially some of the points that I wanted to make. Point number one is we need to actually provide accommodation for our frontline healthcare workers during the pandemic. And this will prevent the virus from transmitting to their family members or to the people, in the congregated settings. It's very important that we protect and make sure that everybody is safe in our city. And point number two is that the same with quarantining. We need to quarantine those who had been tested positive of the virus. And as one of the deputants stated, some of them may be living in condominiums, apartments, and whenever there's it's very important that we don't put other people at risk. And that's why we need to have some measures and ask the province to consider doing some quarantine of the people that have been tested positive going forward. Because as one of the deputants said, in order that the future will be better, we need to act now. So we need to be proactive in enforcing some of these protective and prevention for the second wave. We have to be prepared for that. In that, we need to have the infrastructure in place to make sure that we protect vulnerables, and especially people that are in long-term care homes, in shelters, in schools, and our children, so that outbreaks will be handled more efficiently. And we've all learned from a new way of living, and we've learned from the past couple of months, and we should be very proactive and taking the leadership in doing some of these infrastructure to protect and prevent the second wave. And the other point, point number 4 I wanted to make is that we need to find ways to help those who are victims of xenophobia and racism. And it happens in Vancouver, I've noticed, not so much in the city of Toronto, but I've heard some stories, and it's very, very, very important as the mandate for mental health, for Toronto Public Health, that we need to help those people who are suffering from emotional distress. And it's very important, and it's really paramount for us to take the leadership in doing all that. Most of these points that I've made is in the motion that we made today, and I'm sure that we still have more work to do, and going forward, we need to work together and get through this. Thank you.
Thank you very much. We have two speakers left, but we are just at 12:30, so procedurally, I must move that the Board of Health extend its meeting past 12:30 p.m. lunch recess to complete its agenda. In breaking ground for virtual meetings, if we can have the video screen back up, I'm going to ask you to raise your hand if you are in support of said motion. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. All present members voted in favor. Technology. Thank you very much. That carries unanimously. And now I have Councillor Wong-Tam followed by Councillor Perks. Councillor Wong-Tam.
Very much, Mr. Chair, and I want to start off by thanking you for your leadership. I recognize that you've been working really hard in front of the scenes, behind the scenes, making sure all the directors on this board are connected, and we cannot say that enough. To our Toronto Public Service, especially to those who have been in leadership positions and those who are on the front lines, adapting to a pandemic and a crisis is probably something that you have perhaps done some training on. Perhaps you were going to lead some seminars on, but to have it all encompassing in the way it has engulfed this city, and I suspect your family life and professional life, is really, to me, inspiring to see each and every single one of you rise up. And there will be those who are not named. There will be those that we will never see. And I just want to acknowledge that work does not come without sacrifice. And that work is hard. And there are probably times where you probably think that, why are you doing this? And I just want to say thank you, because you're doing it because that is who you are, a member of the dedicated Toronto Public Health, member of Toronto Public Service. And without you, we would not have the response that we have today. Is it perfect? No. Is it evolving? Yes. Have we gone through something like this before? No, not in our lifetime. And yet everybody is pulling in the same direction. And I want you to know that even though there may be some criticism, and maybe people will tell you that you're not doing enough, I recognize that you are doing, and you're doing it together. And the responses that we heard from our senior leaders today is that there are polite conversations being had with the provincial and federal government, and that those polite conversations of support may be coming. Well, I regret hearing that, largely because we need them at the table today. We need them saying yes today. We need them actually doing more today, not necessarily asking us to bear all the responsibility or the majority of the responsibility, and that one day they may step in with more. The human toll is very, very high, and I recognize that you have really carried the bulk of that burden. So I just want to say thank you to you, each and every single one. When we can meet again on the other side, my thank you in person. And with respect to the motion, I'll keep my remarks very short there. I support the motion. There was a lot of good intentions that went into the motion. The theme around the motion is driving equity and making sure that people are included in the change. And the forward-looking piece of the motion is about how do we capture the opportunities so we can build a more resilient society moving forward. We have had a shelter and a housing crisis for years now, largely unaddressed. The pandemic made things worse, exposed all of that. Moving forward, let's make sure we have the opportunity to fix it once and for all. Thank you.
Thank you very much, Councillor Wong Tam. And I have next Councillor Perks.
Thank you, Mr. Chair. And to Dr. Davila and all of her team, thank you for all you have done to keep Torontonians safe and healthy. I know that for many of you, that's been a great personal cost, and your work is deeply, deeply appreciated. To date, there's been a strong emphasis on the cooperation of different orders of government, different agencies, the Board of Health, the Ministry of Long-Term Care, and so on. And it's been important that Torontonians understand that all orders of government are working together to try to manage this. I'll tell you from many of the things I heard today and some things I've heard recently, it may be time to revisit that cooperative spirit. Today, we have heard, and in other circumstances, we have heard about a dramatic failure on the part of within the provincially regulated long-term care system. We heard about a shortfall or a shortcoming in provincial funding for emergency housing. We've heard about an inadequate testing capacity to be able to meet global best practice. You have heard about an inaction at the provincial level, the provision of a safe supply of opioids. You have heard about a lack of support for provincially regulated group homes and personal care rooming houses. Heard about a shortfall of personal protective equipment and having to ration it so that many who need it don't have it. Of course, we've known for some time that despite an early promise, the provincial government has not come forward to provide any support for our transit system. Together, all of this can be taken to show that we could have done better. Something we need to acknowledge. And note that in the motion that is in front of us, there are several requests for the provincial government to try to get up to a better standard of participation in fighting COVID-19. Some of those will be going to City Council. I'm certain at City Council I'm going to be raising inadequate response from the provincial government. We need to do better. They need to do a lot better.
Thank you very much. Those were all the names I had on my list to speak. Are there any other members of the board who wish to speak at this time? If so, could you unmute yourselves to indicate so? Okay. Then, at this point, we come to the conclusion of this item. I will ask, there is a consolidated motion in front of us. I will ask the board to call the vote.
Directors, when I call your name, please unmute your mic. Indicate your vote by stating in favor or opposed and put your mic back on mute. Director Ashna Bowery.
Favor.
Director Stephanie Donaldson.
In favor.
Director Angela Johnson.
In favor.
Director Cynthia Lai.
In favor.
Director Mike Layton.
In favor.
Director Kristen Wong Tam.
In favor.
Director Joe Cressy.
In favor.
Director Ida Lepretti.
In favor.
Director Jennifer McKelvey.
In favor.
Director Kate Mulligan.
Favor.
Director Gord Perks.
In favor.
Director Peter Wong.
In favor.
Director Sue Wong.
In favor.
Mr. Chair, that's unanimous.
So with that, that concludes our special meeting here today. My deepest thanks and gratitude to every single member of the board for all the work you've done and for being here today. And again, to the team at Clerks. This was our first time with public deputants in this city, and it worked, and I'm thrilled. And thank you as well again to our Toronto Public Health staff. Have a great day, everybody. Thank you so much.
Thank you.